While it's been nearly 40 years since
meeting. It's August 23rd. We will begin with a pledge of allegiance. Please join me.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
To begin, we have public comment. Is there any public comment for the Humboldt County Commission meeting? If you're on the phone, press *6 to unmute yourself. I'm not hearing any, so we'll move on to.
Do you have a comment?
Oh, we do?
Please come up.
Come on
Yeah,
up.
come on up.
Sorry, I was waiting on the phone. I wasn't looking in the audience.
I know it's pretty packed right now. Greg Albertson for the record. I just wonder if we could maybe move our issue up, I guess, or not issue.
I don't see a problem with that. If we can,
It is number.
what number is that?
17,
Sorry,
18?
this is Wendy Maddox, purpose of the record. I just need to make sure, I'm assuming the sheriff's office will be here as well.
Okay.
And so I just want to make sure that that's okay with them.
That's good advice.
I can send under Sheriff Malone a quick text and see if he can head this way.
If you'll let us get just this few little items, housekeeping items done, and then we'll go right to you.
Oh, thank you, sir.
Okay. We didn't have any minutes, right?
No, sir.
Okay. No. That takes us to approval of expenditures. The expenditures have been around and I think all signed. Are there any questions? If not, will somebody make a motion to approve the expenditures, please?
Mr. Chairman, I make a motion that we approve the expenditures for Humboldt County for the time period August 10th, 2021 through August 23rd, 2021, as presented.
Okay. The motion's on the floor. Any further discussion? If not, all in favor, say aye.
Aye.
I should have said in the beginning, let the record show that Commissioner French is not in attendance today. Motion passes unanimously. We'll wait for the sheriff to come and then we'll go to that item, but have the consent agenda. Any item appearing on the consent agenda may be pulled down and discussed in detail. Is everyone taking a look at the consent agenda? Is there any questions? Anything there that you would like to pull out and discuss independently? If not, is there a motion to approve the consent agenda as presented?
Mr. Chairman, I'd make a motion to approve the consent agenda as presented.
Okay. Motion's on the floor. All in favor, say aye.
Aye.
Motion passes unanimously. We have, I'll come, I guess we could do the reports. Is there, I'll have to back up. I moved on too fast there. But miscellaneous reports and correspondence, September 7th. This is information of upcoming meetings. September 7th, 2021, Humboldt County Commission meeting. The September 9th, 2021 will be a Regional Planning Commission meeting. September 13th, 2021 will be a Regional Airport Board meeting, and September 20th will be a Humboldt County Commission meeting. Is the sheriff going to come in? Do you know?
I haven't heard back yet from the sheriff.
Okay. I would assume he would want to.
They were here earlier, so I think they do want to be here.
Yeah. So reports from commissioners. Commissioner Hill, would you like to begin?
Sure. This Commissioner Hill, on 8/17/2021, I had a debt commission meeting. We just approved nothing outstanding that I think stands out anyway. And then on, I think it's 9/12, I've got to go back through the emails. We've canceled a few of our Paradise Valley Conservation District meetings due to lack of attendance or lack of availability, I guess, of folks for vacations or whatever. But it looks like on 9/12, we're going to meet again in Paradise Valley for that district. I think that's all I have.
Okay. Mr. Haas?
This is Commissioner Haas. On 8/9/21, I was president at the airport board. There was a request from the Reno Sports Car Club of America to put on a Solo 2 autocross event at the airport. We've held these before. There hasn't been one since 2016. The board is going to work with the team from Reno to see if the event will be feasible for us. More to come later. Eclampus Vitus gave the board a sample of the working on a plaque that would be placed at the airport in regards to the airmail beacons. In 1924, the Postal Service developed a more reliable system using approximately 1,500 airmail beacons between 3 and 5 miles apart so that they could fly at night. Beacon 32 is still actively guiding pilots into the Winnemucca Municipal Airport at night and in bad weather. The plaque should be done in September 2021. It'd be very similar to the plaques that we put on the courthouse and other places around town. There's quite a history there. I also went on a tour of the complete airport and a tour where the proposed offloading site for sulfur for the lithium mine, if they get their permits to open the lithium mine. I attended the special board, the special broadband meeting on 8/12/21. And the board, along with the partner with Zito, we're going to send a letter off to see if we can get some funding for that. I attended the LEPC meeting, Local Emergency Planning Committee, on 8/16/21. Carol Lynn, who is going to be the new emergency manager, was on virtually. She's looking forward to joining us in December 2021. There'll be a hazmat exercise in September. Part 1 will be on the 22nd at Sayanco, Hazardous Refresher and Incident Command. At 9/23, an incident will be set up on Jungle Road with all emergency agencies asked to participate. On 8/20/21, I attended a Central Nevada Regional Water Authority meeting. It was held in Fallon, Nevada. There was the typical approval of minutes, financial reports were given. The state engineer, Adam Sullivan, was present, and he gave us some information. We exchanged information with them. He says lack of personnel at the division at this time, and he's working to get the records digitalized so that they'll be more available to the public. Micheline, I believe that's how you pronounce her first name, Fairbanks, was there also from State Water Resources. She needs more money to fill budget holes. Preferred basin funding and American Recovery Act funding. Also, lack of personnel was a large topic. We had a discussion on ET, which is electronic tracking. And that's being done by satellites on basically all over, mainly on the ranches and the farms. We were concerned about making sure that this won't be misused data. And the proposal would open a platform to make data public. It's already available to the public. It would just make it more available. Discussion about Aquatech, which is New Nevada Lands, and protests possibly being filed by Churchill and Pershing County about the proposed designation order on 16,000 acre feet of water. A discussion was ensued, and this may affect Paradise Valley. So we may be getting some letters from them explaining it all, or the other board. The annual report for the fiscal year 2020, 2021 on the water report. In 8 of the 12 program basins, water levels fluctuated. The 4 other groundwater experienced noticeable water level changes due to in large part to groundwater pumping from mining and the drought conditions. Local residents volunteered that groundwater pumping has become significant in Clayton Valley over the years, due in large part to the lithium mining operation throughout the valley, which utilizes distillation pond type recovery processes, which are in turn dependent upon large-scale groundwater pumping. Now, this is taken right off of the report from Pennington. He's hired by the board to do these. And observed this year, 2020, in Clayton Valley looked essentially like one vast open lake due to the large number of distillation ponds throughout the valley. Also this year, 2020, the well known as the Clayton Valley Northeast Stock Well is again dry. Static water levels in this well was typically at 171 feet. The well sounded to be near 200 feet in depth. The well is dry and reported as such. Observed is a new and expanded lithium mining complex constructed approximately 1 mile north and down gradient from the Clayton Valley Northeast Stock Well. This year, 2020, the new mining complex has constructed 2 very sizable distillation type recovery ponds. All ponds are full. The stock well is dry due to the down gradient of the dewatering activity for the lithium recovery. So due to the drought and due to other reasons, we're losing a lot of water down there. That ends that report. Thank you.
Thanks, Tom.
Commissioner Tipton?
Yeah, I didn't have anything. I have a hospital board meeting tomorrow night, but I didn't have anything. I had America Rescue Plan meeting on Tuesday. I don't know, Gina's gone. Is Rochelle going to talk about that today or in the report?
No, Michelle is, or excuse me, yes, Gina is gone today. So she will not provide a report.
Okay.
So she'll do that again on September 7th.
Okay, I'll just let you know that we talked about, again, about a county monies that we received where we would like to spend those, and we're trying to spend those in the rural communities. I'll be meeting Thursday night in Denial with that community to see what their needs are. So if you're in a rural community and you have ideas of things that you need that would qualify, please get a hold of me or Gina, and we will move forward if we can on it.
Yeah, I was asked who to contact, so I'll relay that. Thank you. Quickly, I had a WCVA meeting, and I brought this because I thought this would interest the commission. The room taxes are up considerably. Even if you go back to 2019, pre-COVID, our room taxes in July and June were up 30%. So $365,463 in room taxes. And that is because there were 40,364 room nights sold as compared to 19 when there was 31,000. So almost 10,000 more room nights. Not only have the room nights gone up, but so have motel room rates because of the demand and because it's costing the motels more now too to operate because they're having to up salaries in order to keep their maids, which there's still a lack of, and maintenance people and stuff like that. So room taxes are 12%. That's what the room tax. WCVA keeps 10% of that, and the county gets 2. June's receipts to the county were almost $61,000. So it's a good shot in the arm. We don't know. I don't know why there's so many people traveling and so the rooms are selling out every night, but it is, and it's helping economy here quite a bit. So that's all I have to report. With that, we're going to move up the agenda to, I think it's item
18.
18.
Yes.
'18 is the sheriff's request to approve locksmith application, consideration, discussion, and possible approval of a locksmith application submitted on behalf of Greg Albertson's DBA Keyman of Winnemucca. Greg Albertson has completed the locksmith permit process with Humboldt County Sheriff's Office pursuant to HCC 5.58.060. This is for discussion and possible action.
Mr. Chair, this is Commissioner Hill.
Yes.
NRS 281A.420 requires me to disclose a conflict of interest. The matter before this body affects both my pecuniary interests as defined in NRS 281A.139 and my commitment in a private capacity as defined in NRS 281A.065. Associated with my private business named Stony Basin LLC, Stony Basin is involved in the business of landscape construction and maintenance, and also the installation of seamless rain gutters. The locksmith applicant is one of several competitors of an aspect of my business that installs seamless rain gutters to the public. My business does not provide any services in relation to their locksmith trade. Importantly, our competition for the installation of rain gutters is remote from and unrelated to the action before the board, a locksmith license. Whether this board approves or denies a locksmith license to the applicant will not result in any financial enhancement or detriment to my pecuniary interest or commitment to my business, Stony Basin LLC. The outcome of this item will affect me no differently than it would any other member of this board. Therefore, I conclude that the independence of judgment of a reasonable person in my situation would not be materially affected by this relationship. And because of this is not a clear case of a disqualifying conflict of interest, I am going to be participating in the discussion and voting on this matter. Commissioner Hill.
Thank you, Commissioner Hill. Duly noted. Okay, Sheriff, I'll turn it over to you.
So Mr. Albertson did submit an application for a locksmith. We completed a background as specified by county code and NRS. As we were completing this, we did receive some information that there was an issue with the State Contractors Board. We looked into that and that was cleared up by Mr. Albertson. It is my recommendation that we approve this application for Mr. Albertson to be a locksmith within our county. And this is based upon our investigation that revealed no criminal liabilities or criminal convictions, criminal arrest.
Okay, so Sheriff, obviously anyone applying for a locksmith business license has to go through the sheriff and get approval through the sheriff's office.
Per NRS and county code, yes.
Okay. Any other questions?
Mr. Chair, Commissioner Haas. I didn't have a real good copy on the computer, but the bond looked to me like it was maybe outdated. Has anybody got a copy of that to?
I don't. Did you see that? I did not, I do not have an updated version of that from the sheriff's office, so I don't know.
The bond, I looked at the bond also. The bond was dated 2020 and it didn't show any clarifying expiration date. And knowing what I know about bonds, usually they're active until they're not paid anymore. So I guess I have to assume that it's in good standing.
Through your name?
Miss Albertson, do you mind coming up to the table just so that you can speak into a microphone? I don't want to get in trouble with our clerk.
No, you're good. Tracy Albertson for the record. The bond was updated with Valley Insurance on July 29th to include my name as well, and I'm on the docket for next meeting.
I can confirm that. She is on the docket for the September 7th meeting.
For,
Locksmith.
For
okay.
She has also submitted an application and there was not sufficient time to get it on this agenda. So she's been put off until the next agenda.
Same business, same bond, two different locksmiths.
Correct. We're both certified.
Okay. Got it. Okay.
Okay.
Does that help?
Yeah, at least it's out in open.
Right?
Anything else? A recommendation is to approve. Is there anyone would like to make a motion?
This is Commissioner Hill. So if the sheriff has looked through everything as he stated and is moving forward with the recommendation, I would also, my recommendation would be to approve it.
Okay.
I'll make a motion. Why don't I just make a motion? This Commissioner Hill, I'll make a motion that we move forward with the application for Greg Albertson to approve his locksmith license according to Humboldt County Code 5.58.060.
Right.
Is that enough?
Motion's on the floor. Any further discussion? Hearing none. All those in favor say aye.
Aye.
Aye. Motion passes unanimously. Thank you. You have a question?
Greg Albertson for the record. Thank you, gentlemen. When can we advertise?
Today?
Since it's been approved, can we advertise?
I would think.
I think
Okay, I
so.
just want to make sure everything's okay.
Yes.
Yes, I do.
Everything else is in order
Yes, it is. This is our last step.
The only,
today?
okay, if Tracy has to come in,
That's a sip.
if Tracy has to come in, can they start advertising now with just Greg's name on it?
This is not in my league. I have no idea. I would personally think that they would be okay because they took this on as two individuals for the one company. So it's treated separately as far as the way we look at it. We don't treat it as one application. We treated it as two.
This is Commissioner Hill. So what I've researched on this, yes, it is true. He needs to be certified. He is certified. She's certified. He has all of his stuff in place to be a business. It's been approved for one locksmith. I would say you can advertise that you're a locksmith. I don't think I would
Okay.
go advertise that you have two locksmiths running around, but advertise that you are a locksmith and you're open for business.
Thank you. With that, can I pass out the business cards to you gentlemen for Humboldt County Locksmith?
Jim, give it to our.
Just give them to me and I'll get them to you.
Okay,
Great.
thank you.
I have one question.
Yes, sir.
It still isn't answered. Do you or do you not have a bond
Yes,
in
we
your
do.
name? No, not in we.
Yes,
in your
I
name.
do.
Okay, is it
Solely in my name?
solely in your name?
No, it is not.
But your name's on it.
But my name is on it, yes.
Dave, why don't we have a copy of it so we can look at it?
Well, we have the most recent copy. We just don't have the one that was updated. If we can,
Can we
what I
get a
would
copy of that?
suggest, and Madam DA, is that if you're going to approve it under the condition that we get a new copy, the updated copy.
We'll do that today.
So I'm sure.
I just told it can be brought up in a matter of seconds. So
Let's
Okay.
just resolve it right now and move on.
And just to answer your question in regard to, just to follow what Commissioner Haas said, Humboldt County Code 5.58.105 says that no person may be employed by a locksmith or safe mechanic doing business in Humboldt County pursuant to this chapter unless such employee is a locksmith or safe mechanic holding a permit. So that's the key. Because she doesn't have a permit, she can't be employed or do business in Humboldt County as a locksmith until that permit is approved.
We understand that, yes.
Thank you.
Yes.
Yes, but he can't.
So she can't fire me just yet.
Don't fire him yet.
Oh, okay.
Don't pick any locks.
So does somebody want to see the bond?
I think we should see it, yep.
Greg, why wasn't this brought forth?
Why wasn't, what, I'm
Why
sorry.
wasn't this brought forth? So we're not having to go through all these, getting people out and up here with the bond. Because the one you submitted,
Correct.
this particular application, it's
I
no
don't
longer
know.
a bond. So
This is all new to me. I don't know.
Come on up, please.
Come on up.
Please, come on up.
When I submitted my fingerprints, I was asked to put my name on it. So I went and got it done. Whether it comes to you, that is not my detail, but it was completed and turned in.
So Dave,
So to clear that,
let's clear this up a little bit
Um,
because the one we got in front of us, the one I read last meeting and this meeting, it's no longer a bond. So that's why I'm questioning
this one,
that.
okay, this is Commissioner Hill. So what I know about bonding is enough, I guess. Greg had a bond under his name. It was in good standing. It was just dated on the day that he had received the bond. There's no expiration on it. Tracy was added as another locksmith, so they had to update their bond to add her name to it. So what they're doing is superseding the old bond with this bond. It all seems legit to me.
Correct. Absolutely.
So he's named on that bond, so I'm not worried that he can operate as a locksmith from today, as far as I'm concerned. He's named on the bond. As soon as she's approved, next meeting, assuming that goes the same, then she can operate as a locksmith.
Thank you.
Does that make sense?
Do I need to do anything further for you at this moment?
Any other questions?
We just approved Greg.
Oh, I know.
You won't have anything to do till, Dave, is there anything else that we may need for the next
Not,
meeting?
not that I can tell. I mean, again, this is not an area that we cover, so I don't know the answer to that.
I think if we can just update this in the
I would say
packet,
yes.
have it rescanned in the packet for later so that it's in there.
If
Shows-
that one,
shows the
that one
updated
did not have Tracy's name on it, is that correct? The one you just?
Correct.
Yeah.
Yeah, the
Yeah,
old
so
bond.
if we
just
could
had-
get the updated version of that in the packet with the sheriff's office, that would suffice.
Yep.
Once you're approved on September 7th.
Madam Clerk, Wendy Maddox for the record. I just want to go back and make sure there was a vote on this item. Okay, thank you.
We approved Greg.
Perfect. Just making sure I'm
Thank you.
following along.
Commissioners.
Thank you, Sheriff.
We did vote on it, didn't we?
Yeah, we
Yes.
did.
Yeah, okay.
You're gonna do the.
Yeah, we'll finish. Don't take off, Sheriff. While you're here, we'll just finish.
Get the liquor. Yeah,
Oh, so you're going,
So we're done with that one, are we not? Hope so.
yes.
So we'll go back to item
17.
7. Sheriff's here, so we'll go to item 17.
there's also item 12 as well, correct? Oh,
I miss them.
Well, they want to do item 12 too, but we can do 17.
Oh, okay.
So,
Item, we'll go
oh,
to,
same bunch here.
Have we moved off of that one yet?
I think so.
I just have one comment. So county code says that any of this kind of stuff, liquor board, everything says that the county commissions must approve with the sheriff the application and all the documentation. So I guess along with what Commissioner Haas is, I guess we need more information when this stuff comes before us versus just the generic form that Dave sends out of why are you bringing this before us? Does that make sense? The county code says that whether we need to change county code or what, but it does say that we need to review the applications, that we need to review the supporting documentation. Something to think about, I guess, in the future that,
And I just had that up on my,
and that's.
and I have to dig through
Yeah.
here because I think this is only the second locksmith we've done.
Right. It even says it for liquor board, liquor licenses and all that stuff that the county commission is supposed to review the application and all this.
Yeah, and I think what they're asking, and maybe it's a little bit different than how we handle it, but as far as supporting documentation, and I think we did it on the locksmith one, when we received a request for information, essentially the board just got all public information. If it's a public record, they got a copy of it, but if it's confidential, then of course they wouldn't be allowed to have a copy of it.
Okay.
I can't remember how that was worded, but basically a broke down version of who's applying, what's required of them. Is there a bond required? Is there anything special required? Then code says that the commission needs to review that too. I guess is what I'm getting at.
All right. So is what I'm reading right now is 5.58.060. And the application together with the results of the sheriff's investigation shall be brought before the county board of commissioners at a regularly scheduled meeting for approval. The commissioners may require that the applicant appear before them before the permit may be issued. The permit shall be issued on the majority vote of the full board of the county. So I think with that, I'm not seeing where we're supposed to forward this to you. I'm not saying it's not there, but I'm not.
I believe if you read through the whole, it does say in there that the commission is to review along with the sheriff is to review and I don't have it in front of me. I'm sorry.
And I'm not sure if are you quoting the same section? I think you may have just quoted it, 5.58.060 fee and permit requirement subsection F.
Yes.
So it says the application together with the results of the sheriff's investigation. I think that in the past, how we've handled it is how it reads. You come with the document and you bring it before the board so that it's heard. But I think that some commissioners also have a request to have more detailed information. So
Okay.
if they could, then I guess that's something that we could do. But as far as a public records request sort of thing, whatever they're allowed to have as a public record.
All right.
Okay, we're good? Are we good, Commissioner Hill? That's it.
I'm good. Yep.
Okay, then we'll go to item 17. Sheriff, this is a liquor board meeting. I'll turn the meeting over to you.
Thank you. Humboldt County Sheriff Mike Allen for the record. I'd like to call the Humboldt County Liquor Board to order for consideration in discussion, possible approval for the fourth quarter liquor license renewals. These are for the Quinn River Merc, Paradise Valley Bar and Grill, Windspur Supply, Giordano Sawtooth Station, BJ's Market, Club 40, Denial Enterprises, Diamond Inn Bar, Pilot Travel Center, A1 Fuel Stop, McDermott Gasoline Motel, Valmy Chevron, and Say Win Incorporated. All above licenses are in order, and it is my recommendation to approve these businesses for their fourth quarter liquor license renewal. And I'd be entertaining a motion.
I'll make a motion to approve the liquor license for the fourth quarter, for fourth quarter renewals to expire September 30th, that will expire September 30th, 2021.
Second.
Okay, I have a first and a second. All in favor?
Aye.
Aye.
Aye. The motion carries. Are there any other questions? Seeing none, we'll adjourn this meeting. Thank you.
Thank you. Somebody said we have
Well, number 12 is the 911 surcharge, which I think Under Sheriff Malone is here for.
okay. Then we will jump to item 12, which is 911 Surcharge Commission, 5-year plan. Consideration, discussion, possible approval to accept the 911 Surcharge Advisory Committee's recommendation to approve the 911 Surcharge 5-year plan prepared by Galena Group and the committee's recommendation to adopt the plan. On December 14, 2020, the board approved request and recommendation of the 911 Surcharge Committee to retain the services of Galena Group, Inc. to draft and update version of the 5-year master plan. This is for discussion and possible action. As I recall, this was on the agenda a meeting or two ago, and we wanted a little further time to be able to look at the plan. So it's being brought back before us again now. Go ahead. Is there anything else you want to add, or Commissioner? I think it was Commissioner Haas that asked this to be brought. Have you got any? Did you see anything in there you have questions on?
No, again, I will commend the Galena Group. They did a great job on it. Under Sheriff Malone, I do have one question or several questions in there, basically. It seems in the report that we used some funds that weren't designated necessarily for the cameras and whatnot. And that there's a they're moving toward not letting us do that. Can you reiterate?
So,
or
yes, that's a great question. Thank you. Under Sheriff Kevin Malone for the record. And I just want to say Stu Cronin of the Galena Group, who wrote this, is online and present with us, so he can maybe jump in. Right now, the FCC has issued an opinion that anybody or any agency that uses 911 surcharge funds for cameras, they consider it, I can't think of the proper term, but they don't like it. However, the FCC is not a law writing federal group. I mean, they can make recommendations, but they cannot write the law. Currently, the Nevada law allows us to use these funds to purchase body and in-car camera systems. And my recommendation is, until that law is changed, we continue. I mean, we're not doing anything wrong right now. The FCC just doesn't like it. But we're also not the only agency in Nevada that's doing it.
wasn't there a recommendation by Galena Group to use a different percentage from what we've been using and to pay for the 911?
There is.
Charge out of there. Would you give us a little more on that, please?
Sure. So I don't know if you guys have this still, but at the last meeting, Stu provided a cost and charges comparison. So for fiscal year 22, the amount for body worn cameras is 41,000, and that stays consistent throughout 2026. The AT&T 911 cost includes a 3% contingency increase over each year. So for fiscal year 2022, it's 105,000 and it goes up to 119,000 by 2026. 70% of those AT&T costs, again, they go up substantially each year. They start with 74,000, just over 74,000 this year, and they go up to 83,000 by 2026. Did I answer your question, or are you looking for more? Or?
So what they're asking for, or what they're showing us in here, if I read this thing right, is that we need to put more of the 911 money into a different portion of what we have been doing. And that's to pay for the 911 cost of.
The recommendation by Galena Group is to put more funds towards paying for 911.
Okay.
Yes. And he also made a recommendation that we have a contract with Humboldt General Hospital to pay for dispatch services. And that fund, or any money brought in by that, could offset the other costs and perhaps use that to pay for body cams and in-car cameras.
And are we pursuing that with HGH?
That's something that I have been in talks with HGH. I've met with Mr. Powers, and I've also met with Chief Brett Piney, and we do have contracts on the table. And with the sheriff and I, we're going to meet with some of you one-on-one to help, or to perhaps get your help in this. Because I started these talks over a year ago with them, and it kind of stalled.
Is that just 911, or does that have to do anything with dispatch as well?
What, the contract?
With the hospital? I mean, they use our dispatch center as well.
Correct. So it would just be for dispatch, yes. Currently, they calls for service are about 8% for medicals. However, each medical call is considerably longer in length and takes up about 17% of total dispatch time per year.
Good, you have those numbers.
Yes.
Yeah, good.
Humboldt County Sheriff Mike Allen, for the record. First of all, I want to commend the undersheriff for his work both on the 911 committee and in what also the work that he's put in on this HGH use of dispatch. He's put a lot of time and effort in this, and this is something that we've been looking at a long time. But I just wanted a couple of things I didn't hear back there and what the undersheriff was saying. So the FCC is not a part of the legislative branch, and we have to take consideration of the separation of powers, where we have the judicial branch, the legislative branch, and the executive branch. And the legislative branch specifically went in and changed the law so we could buy body cams. And as a result, us as a county, we increased the fee on the 911 surcharge. So if we take away the body cams out of that, then more than likely, I guess we need the judicial branch to make a interpretation of the law if we did anything different than the way this plan is being organized at this time.
This is Commissioner House. I'm not advocating by taking any of the body cams out. Okay, they did say that in there we have allotted some money for that, and then there's a breakdown in there also, isn't there, about what the allotment for the 911 or the dispatch fee would be from this fund, and what the percentage is for the body cams. I think that's what I saw in there.
Yes.
Okay. So Is this presented to us to make a determination on what percentages we want? You know, this was the recommendation from,
This is the
Later.
recommendation from, the 911 surcharge committee. And yes, it is up to you as the commission to
Okay, there's-
accept or deny.
and there's 3 different ones in there. Is there, am I correct?
Yes.
Okay. Dave, could you bring that up so that we could all see it? It should be. in
I'm
this.
not sure which one you want. I've got one of them up, which shows the
We're going to have to. discuss
estimate revenue expense and remainder.
There's a definite
blood draws.
paragraph in there about how
Hospital doesn't-
how it can be allotted. What percentages we probably should use toward the allotment, toward dispatch and toward the body cams.
Hi, this is Stu Cronin. May I?
Stu might be able to help us here.
With the Galena Group?
Yeah, go ahead.
Sure. Yeah, what we did was because you have a finite amount of money, we left the amount of body camera money, so to speak, that was being used in the past year as the same to mitigate anything that the FCC might be able to do, because there is some state funding and so forth that they control, and that could have an effect on legislation in the future. So the impact to the county wouldn't be as great by keeping that amount, which is 41,000 and change, across the board. And then because you have a finite amount, we wanted some reserve, and really that's where this percentage comes into play, as far as how much is paid for of the AT&T 911 fees. So what we use as an example, and the one that's up on the screen right now, is actually a 70% version. There was a 70, 80, I think, and 90% that we included at the plan. And we kind of leaned on 70% is enough, and that gives you some reserve, about $40,000 in the current number, to be able to spend on other things, as opposed to things that you've already spent money on and have contracts for, and would give you that reserve anyway every year.
Chairman?
Yes.
I have a question or a comment I think I should bring up here as a county commissioner and as a hospital board member. When we look at that, I understand where you're coming from there on your costs that are associated with dispatch. As a hospital board member too, I look at the calls for blood draws that are issued by the sheriff's department that the hospital does at no charge. And I wonder where that will balance out. I mean, it makes a big difference in the sheriff's department's budget. I could see that. But as a county as a whole, you know, would the hospital want to then start charging for those ambulance runs?
So, I mean, my take on it is if the hospital wants to charge us, they should charge us. I mean, if everybody, pays for the services rendered, I mean, that's the most honest thing on the table for me. Currently, as many people know, I worked for the hospital in EMS for about 10 years, while I also worked for the sheriff's office. And I know a lot of those deals back then were handshake deals between the chief of EMS at the time and the sheriff at the time. So there was nothing in writing. There was nothing, it was just, you scratch my back, I scratch yours type of thing. I mean, in my opinion, a contract is the way to go to keep everything, transparent. And if they want to charge us for services, they should. I mean, I don't know the exact number, but it would change every year. But right now, 17% of total dispatch costs is probably right around $170,000. I don't think we're utilizing $117,000 or $170,000 worth of blood draw services.
Yeah, I don't have those numbers either.
And in fact, the recommendation in the document is just to continue with that discussion and come up with an agreement with HGH, and is not something that could be hashed out today, I don't think, but in any case, it was just to approve the document.
I understand that.
Yeah, okay. Any other questions? There isn't. Do we have a motion?
Mr. Chairman, I'd make a motion that we approve the 5-year Humboldt 9/11 5-year master plan as presented in its final form.
Okay. Motion's on the floor. All those in favor say aye. Aye.
Aye.
Aye.
Aye.
Motion passed unanimously. Thank you.
Thank you, guys. Have a great day.
Thank you.
Explanation.
Is there that's in, nothing else for the sheriff, I guess.
I don't think so, no.
All right.
Brought up a
So
lot of
that's,
questions.
well,
So we'd go back to 8. I don't know, Tim Powers, are you on the line?
Right here.
Oh, he's right. I'm sorry, I didn't see you out there, sorry.
Did we do 7? Sorry.
That's even better.
Did we do 7? Mr. Chair?
Huh?
She has a question.
I just didn't know where we were going back on the agenda, and I didn't know if you'd already done 7 or if you were just skipping 7.
We did 7,
Oh, you did?
consent agenda.
Thank you.
I'm a little
Yes.
lost.
Thank you.
Oh, yes, we did.
yeah, it was.
Moved and passed.
Okay, so that item 8 is the presentation from Humboldt County Hospital CEO Tim Powers. Humboldt County General Hospital CEO Tim Powers will provide an update on hospital activities and healthcare for information only. Welcome, Mr. Powers.
Thank you very much, Commissioner. Tim Powers for the record, and County Commissioners, I appreciate the opportunity to be here. I was on the call this morning, and I was trying to bide my time on how quickly to get over here. So if I got here a little late, I apologize. A lot of good discussion going on today. And, you know, kicking things off, yes, we've had, since I started here going on about 2 years ago, 3 really impactful events happen. The first, and everybody has suffered through this in the community that has visited the hospital, unfortunately, and that was our Cerner EMR installation. And I will tell the commissioners from personal experience, about 13 years ago, 12 or 13 years ago, when I was CFO at my previous hospital up in Idaho, we were the 2nd hospital in the country to install Community Works, and it was no different. It was a disaster. Now, what makes it so different here at Humboldt is the suite of services we provide. We do a lot more things here at our hospital in this community than most critical access hospitals around the country. And that Community Works product from Cerner is really basically kind of an off-the-shelf product. They do some customization with it, some rules building with it, but for the most part, what you see is what you get. And we had to do a lot of customization here for our facility, and unfortunately, it didn't go well. And Cerner prides to tell people that they got this installation done in 6 months. That's nothing to be proud of. That sounded like me. They wanted to run for the hills and get away from this because it's a complex hospital that we have here. But that ongoing process, we've had to bring in a lot of different people, and after a year and a half or nearly 2 years come this November, are the kinks worked out? No, I don't think the kinks will ever be worked out, but we're doing our best to address the issues and make the clinical side of the experience from a medical record point of view as good and as efficient as possible. The second thing, and y'all talked about it at length today, COVID. Our hospital, like every other healthcare provider in the country and actually around the globe, has had to change the way that they deliver care. And we had to do it on the fly in a lot of cases. This thing really overwhelmed a lot of facilities. And if you haven't seen one, Mayo Clinic has put together a COVID tracker, and it gives you a running 60-day kind of a movement of per 100,000 population, how this thing is spreading. And I will tell you this, probably about the 1st of June, the country, if you go dark red, red, amber, and then just a hint of yellow, the entire country was yellow, which meant there were very little COVID positives going on around our country. Beginning about the second week of June, that thing started heating up, primarily in Florida, Missouri, Arkansas, Texas, and Nevada. And then we have seen it completely take over the country. It's all that deep red color right now. So we're dealing with it again, and dealing with it as best we possibly can, making certain that we deliver care. There are no, hiccups in that respect, but doing it from our staff's point of view and from our patient's point of view as carefully as possible. And then the last thing.
Hang on.
Little feedback. I don't have my phone on.
Now you're good. Sorry about that.
Good? All right, thank you. The last thing, and it occurred back in February, we had a ransomware attack. And, we've got pretty good cyber insurance with PoolPack. And we had a key element of that was getting boots on the ground immediately to help us out. I will, give the board all the credit in the world when we came to them and said we had to change our network infrastructure to be more up to date, to be current with technology. The board didn't waver, and we have since installed a state-of-the-art security backup. Does that mean we're 100% in the clear? Absolutely not. They are going after hospitals right and left. And it's a particular type of ransomware that's being utilized around the world. It's coming from Russia, and it is, in a lot of cases, very devastating. We were really fortunate. We had no personal health information that was compromised. We had a lot of downtime with a lot of corrupted systems and desktops and computers, but we continue every day to make improvements in that area. And I think the security of our data and information right now is as good as it's ever been. Those three things have really been impactful for the organization. What I'd like to go through is some of the accomplishments we've been able to do. For years, I'm not exactly sure how many, the rev cycle process was outsourced here. And I can't begin to tell you how many conversations I've had with community members about being bankrupted, having their credit destroyed, not being able to get a home mortgage, not being able to get a credit card or a cell phone because Humboldt General Hospital or somebody acting on Humboldt General Hospital's behalf put their life in a tailstorm. Immediately coming on board, knowing that we had outsourced that, we were trying our best to deal with our third-party vendors to minimize those types of confrontations with our patients and community members. The way the contract was choreographed with Cerner, the collection group had a very low threshold to collect from. What that ended up doing is I could go into a lot of detail on this, but suffice it to say, if we continued to go down the road with this group, ultimately the hospital would have been out of business because they were collecting around 35% of what the total bills were. And if you take a look at our contractual adjustments and what our typical bad debt would be, that's probably about 18% less than they were supposed to be doing and what we're currently doing right now. So again, we put a plan together. We have created a really, really strong team internally of people that live in this community, that work at the hospital. And I would put this business office group up against anyone I've ever seen. They're dedicated, and effective July 1st, we brought that back in-house. Will we have issues with billing? Unfortunately, people in here have looked at their EOBs. They're very complicated. Cerner is what is known as a clinically revenue-driven system. So every time you click as a provider or a caregiver within Cerner, that triggers a revenue, some revenue activity. We are still in the process of really taking what was originally architected and fixing it because it was not architected properly. And it's been a long, drawn-out process. I'm sure Ken, as one of the commissioners here and board members, has heard these stories from myself and my revenue cycle team and the CFOs at the hospital. But it's a difficult process. It's a complex process, but we are committed to getting that done and getting it as perfect as possible so that that experience that a patient has from making that phone call or having a referral done, getting registered at the hospital, having care done until they get that EOB as transparent as possible and have that experience to happen with as little friction as possible. Do you have any questions? Local staff is really having that conversation with the community members if they have questions with their bill. One of the things we have talked about is possibly opening up the West Campus to have patients, if they've got questions, to go over where our business office is. We haven't figured out the logistics to that at this point, but we really think that being more available, having more access would really make that patient experience much, much better in our community.
I have just a little input here, if you don't mind.
Yes.
Seemed like he was talking about how bad Cerner is. It was the best that we could find. There was a better one called Epic, but Epic will not serve hospitals of our size. We would have to have partnered with Renown to get Epic in, and that's why we went with Cerner.
And may I piggyback on that too, Ken? At my previous hospital, there was a lot of, we were the only Cerner solution, probably within all the way to Boise. St. Alphonsus had Cerner, but they had the more robust Cerner system. And all of the hospitals around us were on Epic. So I had reached out to St. Luke's in the Magic Valley about us possibly being hosted by them. And we really didn't do this with a lot of fanfare. It was really held close to our cards close to our chest. Board knew what we were having those conversations. The problem you have there is what customization we've got with Cerner right now, you would not have with Epic on a shared system like that. The workflows that Renown would have, if that's who the hospital had chosen to go with, would have been their workflows, not Humboldt General's workflows. So I would characterize it this: it's the best of a lot of bad EMRs out there that is affordable for critical access hospitals. So we must do with it what we can. Back in the July timeframe, some of the comments we had from community members, our pricing was way out of line, and it was. So we did a pretty exhaustive research on lab and some of our imaging pricing and reduced those prices at that time. We've seen since July 1st, our utilization in both lab and radiology has gone up significantly. I can't pinpoint it directly to those lab pricing and imaging pricing being reduced, but I would be hard pressed to point to anything else other than, well, we've got a more attractive price list out there for the community. We conducted a community perception study. We got some baselines for improvement. We're putting tactics underway to make positive improvements in the patient experience. I was talking about the billing side of the world, but just what we learned through that community perception study is we've got some work to, one, rebuild the trust of the community and really create a better experience for our community members at our hospital. Inside the hospital, the first day I came to Humboldt General, it was, I think it was the first day of February 2020, and it was cold, and I didn't know where to go. So I parked in the underground parking. Well, it took me 30 minutes to find administration. So one of the things that we've done is put up wayfinding guidelines in the hospital with the installation of maps, and hopefully that has improved people going from station to station or ancillary service to ancillary service to get around in there. And we've also installed digital signage throughout the facility to provide information to patients and staff. So TVs, they screen 24/7 updates on there. So I think that's gone a long way to, one, as people are waiting for tests or waiting for loved ones to have tests, it gives them something to do other than mess with their iPhone or their smartphone. Back in May, again, being an island community, it's pretty easy to determine the more services we can provide here, the better. We've got a lot of people that are traveling down the road, whether it's the Salt Lake, whether it's Boise, Reno, Elko, to have services done. And I will tell you this as a person who had a significant healthcare event and had to have chemo for 6 months, traveling after chemo, horrible. And the data I see with our community, we have a lot of people that are going through that. So starting with some of the services that really will have impacts on our community, cardiology. We affiliated ourselves with a group that not only provides cardiology services, but they provide cath lab services. And our cardiology group, Dr. DeShutter is a cardiologist in Reno. He will be our on-site cardiologist here at Humboldt General. Began in May. We've seen significant increases in our clinic traffic. Over the course of that time, we have also sent, I believe, over 20 people referrals for cath procedures at other facilities. So we've got significant cardiovascular issues going on here. Our cath lab, we got a $1 million grant from the Pennington Foundation in Reno, and that went to buy the equipment, the initial equipment for the cath lab. We are now in conversations with the Helmsley Foundation, believe it or not. They have, if y'all know Leona Helmsley from the hotel guru and her husband, one of the trusts she set up at her death is specifically geared towards rural health needs and bridging those areas that are underserved. So we've been in conversations with them now, I guess, for about the last 3 months. We finally got a good set of drawings for that cath lab. They're putting the MEP in right now, hopefully to get them stamped and get them submitted to the state. So we'll have a fairly good idea of what that cath lab is going to cost, at which time we'll re-engage with the Helmsley Foundation and hopefully get some partnering with them as well, like we did with the Pennington Trust. In September, next month, we're starting urology, another service that this community is desperately in need of. Dr. Drew, who was previously Reno Urology Group, they have a mandatory retirement and he is not ready to retire. So he reached out to us a number of months ago and he will be starting a week at a time. And I believe he's going to be doing 3 or 4 clinic days and either 1 or 2 OR days during those weeks that he's here. But I will tell you this, in a community of this size, if he's not seeing 35 patients per clinic day, I'd be surprised. Huge urology needs in rural areas. About, I would guess, back in the February timeline, we canceled our hospitalist contract with RPG. And as part of that cancellation, getting those doctors, community-based, hospital-employed physicians, we were really happy with the hospitalists we have, and the hospitalists were really happy to serve our community and be here. One of the things in that contract negotiation with RPG was we had to give up an additional year. They also engage our general surgeons at the hospital. And so I had to extend that contract until June of 2023. But what that did get us are our 3 hospitalists that began with our hospital back then. The next vendor we have talked to is Synergy. They've been providing our orthopedic coverage at the hospital for a number of years. And we are in the process of canceling that contract at the end of the year. And I am happy to say his contract will be brought to the board tomorrow night. We sourced a board certified in ortho, trauma, and spine orthopedic. He comes from currently Bristol, Connecticut, if you can believe that. He grew up in the San Jose area. He loves where Winnemucca is geographically. He and his wife spent some time here. They love the town. They want to be here. And he is geared up to start the first of next year. So we're really, really pleased. His name is Dr. Jeff Meter, and he's just a pleasure of an individual to be with. We are looking for a second ortho candidate, and we're being a little more selective on this one. We want somebody that's very young in their career that could be mentored by Dr. Meter. So we're looking to hopefully do that sometime mid-year next year. And eliminating the need for these contracted surgeons is just a huge change, a paradigm shift for our community and for the hospital. And I think it dispels a lot of things that have been said in the past that we couldn't recruit providers here. Yes, we can. There is a way of life suitable for everybody, and all you have to do is find those individuals, sell them on the community, sell them on the way of life here, the culture, and they will come. And Dr. Meter is a perfect example of that. A few of the plans we've got going on, just recently last week, the USDA through the American Recovery Grant set up about $500 million, and they need to get rid of this money quickly, believe it or not. And it's earmarked primarily for rural hospitals. And I've had a relationship with USDA in the past, and they're a government agency. We're ag area right here. And one of the things that you're supposed to submit a white paper, we have a web meeting tomorrow with their, I think it's a deputy commissioner, kind of giving us a better roadmap on how to get at this money. But one of the things that we have talked about in the past, but it's always related to capital, is tough to come up with capital. In conversations with Nevada Gold, one of the things they would like to partner with us big time in here, in this community, is a pharmacy. And the hospital's got a 340B plan that's just a fabulous plan that gives us access to really, really expensive drugs at a discount. And our friends at Nevada Gold are self-insured, something I'm going to give you just a brief hint about after this. And they have some either employees or employees' family members that are taking some very, very expensive drugs in this community. And through a partnership like this, through a retail outlet, we could be offering those drugs at a much deeper discounted price, not only to them, but to the community as well. And I do know there is no drive-in pharmacy here. That's one of the other things we were talking about too. So I'm going to talk to the board tonight. Ken, I'll give you a sneak peek on this one, but this is kind of us taking a look at USDA as being kind of that monetary partner to do something like that. Nevada Gold's got a lot of good ideas. We've had a lot of family members in this community that are driving down the road because that's the way their plan is set up, that we could be providing those services here. So we've had really, really good calls with them, and this is just one more of those calls that hopefully turns out into something we can all be proud of and really take advantage of in this community. Back to expanding services, we're looking at ophthalmology. We have some ENT in the community, not enough exposure there. And we really want to evaluate through maybe the health needs of the community here, what specialists we need to get in here. If we can't get them in here as employed docs, what specialists do we need to get in here visiting to take care of our population here? I've reached out to the Boise market. We've reached out to the Reno market. We've talked to Salt Lake. So those conversations are ongoing. But right now, everybody's hunkered down with this COVID stuff. So it's kind of tough to really get commitments from anybody. I just want to toot the horn with our family medicine rural residency program. It's only one of two in the United States in a critical access hospital environment. And we've got a fabulous medical director, Dr. Lacey Feddick. She came back to the community. She leads that program. She's a fabulous person and a fabulous provider. She's got some great ideas about how to really take that program and start getting active in the recruiting process in medical school. So she and I have been talking about that along with Brian Washburn, our director of operations. So you might see some changes with that program. We've also included Doctors Palmer and Rogers in that from down at the University of Nevada, Las Vegas. So really proud of that program. And we do have a third-year resident who wants to stay at the hospital. Dr. Masick, a couple of years ago, came out of the residency program. He started at our hospital, and now we have an additional position in the residency program that's interested in staying here. So that's what you want. You want to develop those physicians, and if possible, keep them in the community here. And then just through sheer attrition on these contracted provider relationships, just as these change over time, continue to recruit and have community-based providers in Winnemucca here. I think that's a huge core element of culture at our hospital, to have those familiar faces there all the time, to be that patient's provider. And we're making really, really big strides in making certain that happens. So any questions that I might answer for y'all?
Thank you. Is there any questions? Looks like you're looking.
Yeah, I have a couple actually. So you touched on the collection bills that went out. That I guess they were probably for COVID tests. They were like $96. I've had several community members. I myself actually got one too. Called the hospital. They said, don't touch it. Don't worry about it. Don't call the collections. Well, I called the collections. They said, yeah, we have it. It's on hold. I said, can you get rid of it? They said, nope, we're not going to do nothing.
We're going to get rid of it.
Okay.
Yeah, one of the things, I mean, some of this, we were talking about it, this COVID money was set up for those kind of things exactly. So to really isolate those, we were talking about writing off those balances to they call it a COVID alias within the definition of the whole contractual piece within Cerner, and just track what those dollars are. I think it'd be good utilization of ours. We've still got about $200,000 of CARES Act funds that we need to find a home for, and I think that'd be a perfect home for it, quite frankly.
Then you mentioned getting all your EOBs together better. One thing I didn't hear though is timeliness on the bills, getting those bills out to folks and insurance companies in a timely manner, not getting those bills.
Correct. We are working to strive to get those. My goal is to get charges dropped in 3 days. And what that does is speed the process up for those insurance companies to be billed and for the EOBs to be transmitted out.
Okay. The other one is, I heard you touch on a lot of the technical stuff, but what about mental health programs and, dietitian type programs that could be offered to the community?
Behavioral health is a huge issue in our community. We were talking about it earlier today about the number of suicides in the area. And we had contracted with a group to provide those services. We need to retool and rethink that. We have an interested licensed clinical social worker who could come into our hospital and really be the structure to support a lot of the issues that we're having. And then we are in the process of talking with a psychiatrist. Actually, it's a colleague of Dr. Adahar, who is one of our providers at the hospital, who has built a geriatric psych center in Iowa. And he was going to be out here in August to talk to us, but COVID heated up again, and his wife has got a real diminished immune system, so we're going to have to reschedule that. But behavioral health is something we need and have to have a presence in our community here. It's just finding the right methodology for delivery.
Okay,
And it's got to be available for pediatrics as well as adults.
I agree. This question, last question, I don't know if you can answer it, but maybe you can just digest it and get the answer. But it came from a community member. They're curious about using prolific ivermectin in positive cases as an option to help keep our hospitalizations down and keep our beds open. It would be given at the time of a positive case, not once hospitalized.
I would be remiss if I tried to address that at this point. I'm not going to practice medicine without a license, but I will certainly ask the appropriate people that question.
Yeah.
And how would I communicate that back?
You could email me.
Okay.
Yeah.
Fair enough.
County, I can get you my county email. That would
Okay.
be, then I can address it, but that's all I
Come to
have.
me as well, Tim, and I can circulate it.
Okay.
Yeah, there you go.
I'll send it to Dave then.
Okay.
Thank you.
I have a question to touch on what Commissioner Hill brought up first on those bills that are on hold. Are we moving through them rapidly? I know at the last hospital board meeting, she said that board members hadn't had theirs taken care of because she didn't figure they were a need. They knew what was going on. And I knew mine still hasn't been addressed. Has yours been addressed?
No, it has not. And I'm pretty on top of that stuff. So
Okay.
I call often.
I suppose we'll hear tomorrow.
Yes, you will. Actually, when I was listening to the call earlier, I was meeting with Darlene, and so she'll have an update on all that at the board meeting tomorrow night.
I just hate to see that slip away or whatever, and then some people get reported to collections, or like you say, it could be detrimental.
Let me tell you, we stopped having the collection agency being advised of patients' bills, put a permanent stop to that. I remember my previous board chair got a call from, was no one in this country. It was from overseas. That's where the third-party collection was, and this was a long time ago. And I was reminded that the people that you're calling, you're going to run into in church, you're going to run into at the grocery store, at the convenience store, at the fairground, and to be really sensitive to that. So I took it to heart, believe me. And knowing that you know, the stories like I shared earlier, people just having their credit cratered through a hospital bill is insane. I will tell you, just through sheer experience, people in rural areas are more inclined to pay their bill than anybody. And they might not be able to pay it when they can pay it, but they are more inclined to take care of it somehow. And I'll hang my hat on that any day of the week. And I'm not going to put it as a huge financial inconvenience for them when everybody's struggling.
Well, and my experience has been, doesn't matter if it's 9 cents or $9 million, if it's a ding on your credit, it's going
I agree.
to do the same thing.
I agree. I agree 100%.
Okay, that's all I have.
Well, I know you've got a tough job, but thank you for your information today.
Oh, sure.
Appreciate it very much.
One thing I just wanted to provide some input. I know the county has been talking about self-insured health plans, and my previous hospital, myself and a couple of the board members went to conferences called Estes Park, and they're being promoted and run by healthcare leaders from around the country. Actually, Horty Springer is the main driving force behind these conferences, and what they are is you get all of these people together, and they're providing their best guess at what's going on in healthcare and what will be going on. And about 8 years ago, I attended one of those, and my board chair was there with me, and one of the conversations started up about the Mayo Clinic, and was looking to align themselves with rural areas and rural hospitals. So I looked into that, and they had this program called the Complex Care Program, and it was more geared toward more sophisticated settings, where you had a variety of different specialists in your organization that could have consultations with Mayo physicians. Anyway, it didn't pan out, but what did pan out of that was our ability to form a really strong alliance in a healthcare network that was self-insured with the Mayo Clinic. And we had been on a Blue Cross plan, very expensive. It was fully insured plan. I had about 35% of the employees covering themselves on it, which told me a lot. I mean, we're a healthcare provider. I can't even get decent health care for my employees, and really did a fundamental change to it in a self-insured environment. I will tell you this, if you've got a really strong tier one network of providers in your network, if you've got a good TPA that adjudicates claims, that reviews claims, and that processes claims proficiently and expeditiously, and if you've got a good stop-loss carrier that is really, really strong in that area, self-insured plans are, to me, a no-brainer. Will you have joyrides like this? Yes. Are you able to put in wellness programs and those types of things that really motivates your employees and their family members to take better care of themselves and to take more responsibility for their health? Yes. I will tell you this. I made a phone call on Friday. I called my previous hospital, the CEO there. I said, JD, where are you this year compared to last year on your claims? He said, on pharmacy, we're down $150,000 less. They implemented a new pharmacy program. And on general claims, we're down 50%. Now, what that hospital does, all of that money, they fund that 100% every year. So they've got that in reserve. It's restricted cash on the balance sheet. They can't touch it. And that dollar amount just grows and grows and grows. When you have the tough years, that's where you go into it, in the tough years, where you have significant health issues arise in your plant, because they're going to happen. Tell you this, Southern Idaho and Northern Nevada, the 5 top cancers, they're epidemic in this part of the country. And we've had those types of cases at that hospital. So is it for everybody? No, it's not. The accounting treatment's a little different, because you have to really stay on top of your incurred but not recorded claims. You really have to have a good process in place to make certain that you're not missing and under accruing that liability. But from a sheer rollout of a health plan, I can't say enough good things about it. So that's been my experience. I just wanted to share that with the county commissioners too, because I know you're going through that as well. And I think it would really behoove the community if we could all be in that same type of plan. I think it makes a whole lot of sense. And I think there's been a lot of talk about that. So I'm all for it.
There was some questions on the antibody machine. Are you using that yet?
Yes.
It is up and running.
Yes.
Okay. Don't hear
It
much
didn't.
about it.
No, I don't think there's and I would have to defer to some of the clinical folks at the hospital about that. But I don't think it provides the clinical data that everybody thought it was going to provide. I think that's the nuts and bolts of it right there, Commissioner. I mean, there were certain things we were going out and refresh your memory, Ken. We got those kiosks, those self-contained kiosks that were going to be robotic. And we got one of those in. They were like $40,000. We got all of our money back. Never worked. And I think as this COVID thing started rolling out like that, there were a lot of opportunities, so to speak, for vendors out there to start peddling products that seemed, the solution to your questions, but really weren't. So I might put that equipment in that category to a certain degree.
Any other questions? Thank you again.
Oh, thank you all very much. I enjoyed it. Appreciate it.
Yeah, I would like to thank you, Tim, for coming to the county commission. I hope you'll be back.
Oh,
again
definitely will.
Later.
Thanks very much.
Thanks, Tim.
Very thorough, and
Tim.
we could
Good
understand
luck.
you. Thank you.
Okay, we are now on 9.
Correct.
Going down the list now? Okay, 9, which is Western Nevada Development District GIS-based broadband mapping project. Consideration, discussion, and possible approval of a request from Western Nevada Development District, WNDD, to participate in broadband mapping project proposal funding request report by Western Nevada Development District, WNDD, on the proposed GIS-based broadband mapping project, and to request for each WNDD member, including the county, to contribute $2,850 to pay for the $40,000 project cost. Discussion and possible action. Dave?
Yeah, Mr. Chair, we've got on the line Des Craig from the WNDD, and I can see him here. Can you hear us, Des?
I can hear you loud and clear, yes.
Very good. I think Des has got a presentation that he can go through, and if there's any way you can keep it brief, that would be great. We've got a long day ahead of us here, Des. Thank you.
Well, thank you, Mr. Chairman and County Commissioners. I appreciate this opportunity to come before you today, and I hope you can hear me clearly. I think there is a brief PowerPoint presentation that goes along with this presentation, but let me just say, by way of introduction, WNDD is an economic development district designated by the Economic Development Administration of the U.S. Department of Commerce. It's a member-driven organization, currently has 7 counties and 7 municipalities and 18 associate members here in northwestern Nevada. And its mission is to work in regional collaboration with public and private entities to create an environment within which economic development can occur. It's primarily an economic development planning agency, and we help our members try and get funding for the projects that they propose to us and are included in our planning document. So historically, that's been mainly in the infrastructure field. Humboldt County has recently rejoined WNDD, and we're very grateful for the support of Humboldt County in the Western Nevada Development District. I come before you today representing WNDD and with a couple of recommendations. The first one is to approve funding to Western Nevada Development District for not more than $2,850 to conduct a region-wide broadband mapping project. And in conjunction with this, second recommendation, in conjunction with this, is to approve community outreach support from Humboldt County, working with WNDD to inform and engage residents, businesses, and institutions throughout the county to participate in this broadband mapping exercise. Now, in the interest of time, I'll give you a brief overview of the project and of the mapping project, and then try and take any questions that you may have with regard to this project. At our WNDD board meeting back in June, at the end of June, I presented a proposal to the board, and it was unanimously approved on that occasion. And I believe that Commissioner Tipton and County Manager Mendiola were present at that meeting. And as part of that approval, I was asked to put together a report, which I submitted to you, and I hope you've had an opportunity to take a look at, complete with these recommendations. But if the broadband mapping project goes ahead, it will produce a map that are most in need of a reliable, affordable access to broadband service. But that's not all. If it was just a map, then that wouldn't be adequate in my mind. But this map, in addition, will also have GIS layers of information added to it, and ultimately, when complete, will become a tool, a mapping tool that we can utilize, the communities can utilize throughout the region for infrastructure project grant applications for communities in the region, resulting ultimately in more robust broadband connectivity across the region.
There's going to be a lot of money becoming available from the federal and from state sources for the digital divide, as it's called, for broadband connectivity. And we want to be ready for that. And that's one of the purposes of this particular mapping tool. So the initial data showing connectivity gaps and the GIS information that will be loaded into this map, we estimate it will cost a total of $40,000, which divided across our 14 local government members is $2,850 per member. And that's the recommendation in the request today. Just a little bit about the project, a little bit more about the project, just for background. We had in our Comprehensive Economic Development Strategy document of 2020, we had included something called our Broadband Needs Assessment Project. It never got off the ground. We never got started because of COVID-19. Instead, the federal government made, out of CARES Act, made money available to the nonprofit, to our nonprofit, to do an economic recovery and resiliency planning exercise. And throughout that entire planning exercise, which was just recently wrapped up, and the plan is available on our website for you to read, but throughout that whole process, that planning process, broadband connectivity and access to reliable, affordable broadband was one of the first, in fact, it was the top issue and challenge that was raised over and over again by our planning teams. So we got to working, we got to researching on this earlier this year. We reached out to other communities, universities, and we looked at what other states were doing. We looked and see what the federal government was doing about this issue. And we discovered that there's quite a lot happening. It is actually a fairly widespread and understood to be a big problem, not just here, but across the entire country. And a lot of money is being made available, as I've already mentioned. And we also talked to the Office of Science, Innovation and Technology here in our own state. They're responsible for the broadband deployment. And we also formed a regional broadband action team from our board members. One of the things that became very clear very early on was that we needed more data. More data is needed to discern the areas that are in need of reliable, affordable access to broadband service. And an interactive broadband map, as is being suggested here today, is one way of collecting in contractors, and they will set up a website, and we'll be asking our community members to engage in this, what's called a speed test, to determine what their upload and download speeds are. And during that time, we'll be reaching out with a marketing plan to members of the community to take that speed test, because the effectiveness and success of the mapping project will depend on a marketing campaign and depend on people actually taking the speed test. Once all those data points are included and once that information is loaded into the map, then we will have a tool which communities can use across the region, as I said earlier, for applying for grants. And that's really the value of this mapping tool. It costs $40,000, as I said, $2,850 from each of our members. The diagram that you saw just now shows that graphically, mapping at the bottom, leading to grant applications, leading to project funding, and leading on to actual projects and better connectivity. I will say, however, that doing a map or having a map or participating in a map is not the panacea or the cure for all of our broadband issues and all of our broadband problems. Of course not. It's just one more tool in our toolkit to help us to access some of this funding to improve the broadband connectivity. Some of the benefits, broadband speeds will be demonstrated at a street level, and also other needs as well. Broadband connectivity is not just an issue to do with connectivity or bandwidth. It may also have to do with affordability, accessibility to devices, education, and so forth. So this map will even be able to help us to drill down and to determine what are the needs in terms of the project that we should be costing. It'll also help us to cost out projects and help us to know if we're being offered a good deal by an internet service provider or by any other provider. And as I say, it will also help us then to apply for some of this money. It will show the county that the commissioners are committed to strengthening broadband connectivity. So I think I'll draw a line at the, I think I'll draw my presentation to a conclusion there. And Mr. Chairman, if there are any questions from the commissioners, I'd be happy to try and answer them. If I can't answer them, I will go away and get the answers for you. So thanks again for your time today. I appreciate that. And I'll take any questions you might have.
Hey, well, I guess the primary purpose of doing this at this point is in anticipation of dollars that will be coming down from the federal government, maybe state governments, to broaden broadband throughout Nevada and the rural areas. Is that right? Just getting ahead of it by getting this part done?
Yeah, in response, that's exactly the reason why. Yeah, there's already money that's been made available through ARPA. There's a big broadband infrastructure bill that's been talked about in Congress at the moment, $65 billion for broadband in that. So yes, we're expecting a lot of money over the next 6 to 9 months for broadband connectivity.
And then did I see that this $2,850 would be an annual fee?
Yeah, the business model is being promoted here. You're correct in that. Thanks for that. Good question. 2,850 will get it started, but this map will have to be kept current. Things are always changing in terms of where is the fiber and how much it's costing to lay fiber and how much it's costing to improve connectivity and so forth. So the GIS information will be updated on a regular basis. So this will be an annual subscription from Humboldt County to WNDD for this purpose for several years. We don't know for how many at the moment. But for several years, no more than 3 or 4 years, I would say at the outset, at the most.
So that was a yes, right?
That was a long way of saying yes.
Okay.
Yeah.
Any other questions?
This Commissioner Hill, how much of this is redundant to what we're already doing with our mobile broadband stuff that we looked at a couple of sessions ago?
Yeah, at the last meeting. Dave Mendiola for the record. This is very different. What the grant that we went into partnership with Zito Media was a very specific project that was going to increase their capabilities in their service area. What this is a mapping project to really identify what kind of service is on the ground in every community. Like today, for example, I can tell you I've had 3 different providers in the last 4 years trying to find one that would work. And I was told one thing and the delivery was very different. And so what they're really trying to do here is with all these grants coming up, there's a tremendous amount of money out there from very different fronts. It's all through ARPA. The infrastructure will have some broadband monies available. And so the idea behind this mapping project is to do a real survey, on the ground survey of what's being delivered in Winnemucca today, so that then we can show what the difference is between what the minimum requirement is by the feds and what we're actually experiencing. That then allows you to go to, in an application, for example, you can say, hey, listen, here's what we actually have on the ground. And this comes from a survey done on the ground. And you're not just saying, hey, we don't have good enough broadband, because that's all we're capable of saying today, is we know it's not good, but we just don't know what it really is for everybody. And so my personal opinion, I'll just say it now and I'll let the commissioners deal with it, the rest of the comments, but I like the idea of this for 1 year. And I don't like it ongoing because, for example, Zito told us that it was going to take 18 months to deliver that project once they got full funding. So not a lot's going to change in 1 year in Humboldt County. Now, it might in Reno, it might in Las Vegas, where you've got a lot of people competing. And so there's changes constantly going there. But I don't see that happening here. So I'm a little uncomfortable with an annual fee of $2,850. I would prefer doing it once. Let's see what we get in terms of information, and let's see what the benefit is in terms of getting grants awarded. And when next year comes around, we'll have data to be able to make a decision that is a lot more accurate.
This Commissioner Hill, will any of this data that they collect help with the Zito project?
Not really. I mean, because they're going to do what they're going to do.
They're going to make it.
Yeah, and I think, for example, after 18 months, Zito's information will be very valuable. It'll show up on that survey.
Is that an option for us to do it for 1 year or do a one-time?
As Craig for the record, yes, that's an option. That's an option. I've been going around various communities and some have agreed to contract for several years. Some have suggested, as the manager just now said, just for 1 year. So that is an option.
What is this? That's not clear to me. You have to go to a library to enter the information?
No, sir. What I'm saying in that report is if you don't have, let's say at your home, if someone doesn't have available broadband, then they've no way of going in and doing a speed test. But they can go to somewhere where there is broadband, like a library, and they can put in their zip code and they can say, I don't have any connectivity at this particular address. And it gets them mapped on the map.
This is going to be mapping for the Winnemucca area or for the whole county? And if it's for the whole county, are you just going to show red dots and forget about it? Because I'm sure that we're going to have, we're going to have some very poor coverage in some very rural areas.
And we want those people in very rural areas to take a speed test or to inform us on and get their data on the map. So it's for the entire WNDD 7-county, 7-city region, but obviously Humboldt County is part of that and will be admitted as part of that, and will have access to the data for the year.
I guess I'm not totally grasping this. You know we don't have broadband in Fort Nevada, McDermott, Paradise, Grass Valley. A lot of places don't have it. What is this going to?
It's going to tell us we don't have it.
We don't have it.
Well, I mean, we have it. I mean, I can tell you there's plenty of ranches out there that have it through Humboldt Telephone.
We do?
Absolutely.
Yeah.
But again, it's not necessarily, well, even if they can provide, and right now Humboldt Telephone is reporting, not directly to me, but I've heard from through some other folks that they're going to really upgrade their broadband because of ARPA funds they're going to get. But today, they might be able to give you 100 megs to the home, but it might cost you $300 a month. So it might, but the cost is prohibitive. So, and I guess what this will say is we'll know very specifically, as long as everybody participates, you go online, what you do is you go online, and I've done this, I do it at my house all the time, and it's very simple. I can do it on my phone. You punch in, test my speed, and it automatically, tells you what you're getting. It shows you right on the application or on my television, how good of speeds I'm getting. So if I'm not getting what I'm supposed to, I can call my provider and say, wait a minute, yeah, I just did a speed test. Anyway, so that's part of it. So we'll get, we're going to have to work closely with them, get the word out in the community that we need you to go on. If you've got a cell device and you're using that cellular provider's broadband capability like I do with Verizon, or if you're at home, just go in, take the test, and the software will do it through their application. And then it'll start updating that information inside the application. And then they'll collect all that data and present it to the WNDD membership, Humboldt County being one of those. And that we can use in our own community to say, hey, here's this came from actual users of the systems. So we can use that for our providers, give them information, say, hey, here's what we're learning on the street. I mean, they may agree or disagree, but it'll come from their own customers. And the other thing we can use it for is for grants. So when we're putting a grant in, we'll be able to provide a full data survey based on customer input that says, here's what we have in Humboldt County. And based on today, if that happened today, I can guarantee you, if the truth really is that the feds want to help the rural communities get up to speed with true high-speed broadband, which today the new level, as you heard a couple weeks ago, is more like minimum of 50 megabytes up and about 10 down, or 50 down and 10 up. But right now we're not even close to that right now. And if they saw that on a grant application, you get bumped up really high. You're going to get a higher bump than somebody just says we have bad broadband here. So that's why I think it's important. But again, I would say that I'm a little questionable on an annual fee without seeing that information.
Any other thoughts, comments, questions?
This is Commissioner Haas. We might be a little early on this. Yes, there's supposed to be a lot of money out there. Everybody is vying for that money. We just got through with the CEO at HGH. I asked about the antibody machine. We spent a lot of money on that, and it's not going to do what we originally were told it was due. It's very apparent that we need to, we went back to, Masto was up here telling us that, she's going to bring broadband into all of the area up here, and it hasn't happened. So I think that anybody that's used any of our electronics knows that we're limited, and that broadband would be a plus. But why do we have to spend $40,000 on having somebody tell us that it's already poor? Because it is. Like yourself, Dave. I mean, you went to 3 different providers. I've been to at least that many, if not more. And is it a good service? Most of the time.
Yeah.
So we might be just a little bit early on making decisions on this stuff.
Yeah, and again, I think the main reasoning is that you and I know that because we've had that experience, but you can't put that in, well, I guess you can. You can put it in a grant application that says, Commissioner Tom Haas had this experience, and you tell him what the experience was, and I do that.
Right.
But if we get responses from 5,000 people, 6,000 people maybe, or even a few thousand, that carries a lot of weight in a grant application because, they're looking at hundreds and hundreds of grant applications. And I think what WNDD is trying to do with this is that let's collect data so that we can give them real live data to support our position to get that grant funding. And I think that's valid, versus just saying we know it's bad, which we know it's bad and they know it's bad. Otherwise, they wouldn't be putting so much effort into, putting all this money out there and people making big speeches about how we're going to bring broadband to the rurals. I mean, again, I think the big value I see here, at least once, is we'll have actual data based on customer input. A lot of customer input versus just saying that our coverage is bad. Because I can tell you there's some businesses in town and there's some different capabilities to go. Zito is a great example. You can get 250 megs right now. Some homes have it today. Do they want to pay for it? No. So that's good. That's really good broadband. So we can't claim that that's, not good enough. But the vast majority don't have good broadband service, and I'm thinking in the 90+ percentile. So that's all I'm saying. It's a data point, which I think would help us. But beyond that, you're right. We all know it.
We may be a little bit early, but I understand the data that would be gathered by doing this. And I would hate to miss out on a grant because we didn't have enough data, and knowing that technology is moving at such a rapid pace that what we think is good right now might not be good enough to handle what comes down the road.
Well, the other part of that too is, so if you think about it, those grant applications just within the WNDD membership, if all of our members are going to get this information, they're all applying for the same grants. And so if they've got data and we don't, that could hurt us. So, because they're all going to claim the same thing with the exception of, maybe Washoe County, but everybody else is going to claim we don't have good enough broadband. So, but they'll have data and we won't. So that puts us at a disadvantage immediately.
We could do this for a year with the option of coming back next year and looking at it.
By the way, that's what the city of Winnemucca did. They approved for 1 year, $28.50, and then we'll come back and we'll look at it. We'll look at the data, see how valuable it is, and then go from there.
And this is Commissioner Hill, the data's already out there. The data's being tracked through web servers or what, we're just paying somebody to extract this data and put it together. Am I correct?
Basically, yeah.
Yeah.
You have to do two things, I think,
Yeah.
to reach out to those customers in Humboldt County.
Have them
to get them to
do
fill
the
in the
test.
information, go online, do the speed tests, and then collect the data.
These guys will collect the data and put it on a map, and the
Exactly.
data's there. It's just
Right.
put it.
Which, when you put it in that context, $40,000 for, 8 or 9 counties, that's quite a bit of work. So.
And if I may just say, again, Des Craig here, WNDD, if I may say that the actual speed test data is only one aspect of the total map. The other information on where the fiber is, how much it costs to put fiber in, where the poles are, where the towers are, what the topography is, what the demographics are, all of that information will be loaded into the map as GIS information, which makes it really valuable in terms of putting together a grant application.
So the Commissioner Hill again, with that being said, that could be an asset for our upcoming projects. So they know where the big lines are at and where the big tie-ins are at. And
What also helps, the GIS piece, and thanks for bringing that up, Des, it also does help in terms of, economic development. So if a company wants to come in, they can see what kind of capabilities we have, broadband, and the other, because there's two issues always, right? It's the speed of your capability, and it's also, do you have redundant networks?
the distance.
Do you have backups? And that's one of the big things we're dealing now with. Cyanco and NGM has been working on that, and we finally got that backhaul. I think Zito made mention of it, that they're getting ready to turn on their backhaul, which would be the second one. They've got the ATT coming through Reno, and then they've got one coming out of Salt Lake. So CenturyLink is what it is, actually. So
right.
So that could be very helpful.
I don't know. I guess 1 year would probably be all right.
I guess I'm ready to try it for 1 year. I don't want to be left at a disadvantage, if it's there. And I'm sure there's going to be a lot of dollars out there. Yeah. Here.
Well, I'll make a motion. We'll see where it goes. I'll make a motion that we approve the request from Western Nevada Development District to participate in the broadband mapping project proposed funding request report by Western Nevada Development District on the proposed GIS-based broadband mapping project for 1 year for $2,850, and that we take a look at it next year to see if we want to go forward.
Okay. There's a motion on the floor. Any further discussion? If not, all in favor, say aye.
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 Motion passes unanimously. Thank you.
Thanks, Des.
Thank you very much for your support. Thank you.
I got it.
Yeah. Want a break? Okay. 5-minute break.
Hey, David Pulley, are you on? Yes, I see you now.
Yes.
Okay,
I'm on.
we're going to take a 5-minute break and then we'll come back to you.
Okay, sounds good.
Thank you.
Okay, we have everyone back, so we are on item 10, Far West Engineering, Grass Valley Nitrate Preliminary Engineering Report. Representatives from Far West Engineering will present an update on the Grass Valley Nitrate Preliminary Engineering Report. This is for information only. Who do we have? David Pulley. David?
Yes. Good afternoon, Commissioners. I am David Pulley. I work for Far West Engineering. We have been retained by Humboldt County to prepare a preliminary engineering report for the increased nitrate issue in the groundwater in the area of Grass Valley. Over the past several years, there has been a slow uptick in nitrate levels. Some samples in the groundwater have shown that nitrates exceed maximum contaminant levels. And so we are preparing a study to consider ways in which this can be mitigated. Grass Valley is a large area, as you all know. There are parcels out there that range from 1/4 acre in size to 10 acres and to several hundred acres in some cases. The groundwater has the greatest nitrate levels in the area that centers around Star City and Gold Country. That's where the highest density lots are. A lot of those lots are under 1 acre in size. Many lots are 1/4 acre in size. So at that location, we have a high concentration of septic systems which have introduced nitrates into the groundwater in that area. So the study is to figure out ways in which we can eliminate this issue. We don't want nitrates in the water. There's several studies on the health effects that it causes and would cause to the property owners out in that area that are served by wells in the area. So far in our study, we have looked at what size of a collection system, wastewater collection system, needs to be prepared in order to collect the water and either send it to one of two options. The first option we're considering is looking at a new wastewater treatment facility that the county would own and maintain, likely located out by the airport somewhere. Or number two, look for ways in which that wastewater could be collected and sent to treatment in the city of Winnemucca. So far, looking at the number of lots in the area, properties, it looks like this to collect wastewater, we would collect it for the area surrounding Gold Country and Star City, the Grass Valley Elementary School out in the area. And we would, it looks like Dave's got that up. If you want to scroll to the last page there, Dave. There's one more page, I believe. Keep going down. There's that figure. Go up one page.
Oh, you want back to the map? I'm sorry.
Yes, the map. Perfect. So you can see Grass Valley Elementary School there and an area in which we're looking at of higher density lots. So within that area, there's approximately 520 residential units, or 540, excuse me, which would equate to roughly a population of about 1,300 people, and which also equates to about 165,000 gallons per day of wastewater. Was there any questions there?
David,
Okay.
you're referring to the highlighted area in black for that
Correct.
residence, right?
Correct. Yes. So The highlighted area includes the airport, which, you know, we're showing a large area of collection. However, that's just encompassing the parcel for the airport. By all practical purposes, we're not really collecting anything on the south end of the airport or there. We would be collecting wastewater in the area of the terminal and associated facilities. So with this entire service area we're looking at currently, and this could be revised, that's highlighted in black, we would end up serving an area that would collect about 350,000 gallons per day of wastewater. There are plenty of treatment facilities that could handle that if it were all sent to the city of Winnemucca. The city of Winnemucca, in coordination with the city manager there, they have an additional capacity of their treatment facility of 650,000 gallons per day. So we're continuing to work with them to see what they would consider being able to allow the county to utilize if that becomes an option. As we develop this study, we'll figure out which option is more cost effective for the county to build a facility or for this the wastewater to be pumped and conveyed over to the north to the city of Winnemucca, and for some of their additional capacity in the wastewater treatment plant to be utilized. At this point, that's where we are at this point in the report, where we still have a lot to develop. There does need to be some community meetings for some community involvement as we develop the options and can explain further what the cost would be. But we do have some preliminary costs. Preliminarily, the collection system that would mostly be just in Star City and Gold Country and the elementary school, those lots to the east of the Grass Valley Road, would cost approximately $15.5 million. So that collection system would either send sewage north to the city of Winnemucca or west to a wastewater treatment facility near the airport somewhere. That's where we stand at this point. I'm trying to I guess I'm hurrying a little bit just because I know you folks have been here a while. So if you have any questions or would like clarifications, I'm open for that.
So the 15 point, whatever you said, 5.4 million, does that includes the facility, sewer lines, the whole shebang, or what?
That 15.5 million includes the cost of installing sewer manholes, pipes, collection systems, sewer lift stations, but does not include treatment. So that 15.5 million is just to collect wastewater and either send it to a county-owned treatment facility, which would cost roughly $6 million, or send it north to the city of Winnemucca, which then we still are in process of needing to figure out what connection fees would be based on cities' rate tables. That there will be a cost to go north into the city and utilize their facility by connection fees.
And you said that would accommodate 540 homes?
This collection system, yes, it's approximately a total of existing 550, but there's expansion area in there for 44 additional residential lots. And there are commercial lots and public lots, as in like the school district.
So The state has a couple of $1 billion that they're beginning to, and they're having meetings. They'll have one at the Boys and Girls Club on the 31st, I think. This is something that should be brought up at that meeting as well, shouldn't it? Our situation in Grass Valley.
Yes, and actually, we've got this particular project on several lists right now through WNDD, because through WNDD, we're going to get funding through the economic development, the federal economic development. So there'll be ARPA funds for that. So we are on the list for that. We're definitely, it's on a list we've already given to the secretary or the treasurer Conan. So it's on that list. And then there's probably 3 others that I'm currently aware of that we're going to put it on our list, including our own Humboldt County one, that the monies we're going to get. Of course, as you can see, that won't even touch this.
No.
But there's also funding, which I just learned about in the last couple of weeks, the state revolving fund, which is the Clean Water Drinking Fund and Clean Water Fund. Those two are where we normally get grant funding. Matter of fact, that's where we got the bulk of the funding for this study. And then one of the things that we've talked to them about was to pay for all the hookups originally in Star City. And they're definitely behind that idea. So the goal being is that we don't want to have a hurdle of people having to come up with $2,000, $2,500 to go away from their septic and hook up into a system that we develop. So that looks very positive that we'll get that money, and they're going to get a lot of money. The state's going to get $6.7 billion, I think it was, and that's what Treasurer Conine's going around about. We don't know the number for state revolving fund yet, so there'll be funds there. So there'll be lots of sources, not to mention the current ARPA. A big part of that, as you know, Commissioner, is infrastructure. And so there's lots of things. That's why I've been talking to Far West and David specifically here about moving through this as quickly as we possibly can so that we can take that data and use that in our grant applications, because it'll be pretty powerful data. So
the other question I would have here is, I look at this black area, and then you have from Commander Drive, looks like Commander Drive, and then if you block that up back towards the Grass Valley School or just a little farther to the east, that looks like your next group of fairly closely populated homes. So when we do something like this, if we get to that place where we do it, how easily will that be for those other areas to join in?
Well, and that's probably where again, who knows where the ARPA funds will be at that point in time. But that's one of the things, state revolving fund, they're very much interested in what we're doing here, because I remember in 2015 when I came on to the county, one of the first questions that I had to NDEP was, at what point in time, if this nitrate levels keep going up, will the state come in and or the federal Environmental Protection Agency come in and say, you have to do something, which they've done that in different places. They tried to avoid that, I'll be honest with you. They don't even want to talk about it, because that's the worst case scenario, because then you're forced by law and by federal fiat that you have to go do something. And then it's not a matter of can we afford it, it's a matter of you got to go find the money for it. So we're in a really good situation now. We got to get this report completed, and then we need to make a decision as to which way we're going to go. I personally don't think it's a great option to just go and pump it back to the city of Winnemucca. It doesn't make, I mean, we have to give alternatives. That's why we're doing it here. We have to give the federal funders alternatives. In other words, show them that we've looked at several ideas. But in the end, this is the time to launch, get this thing done and get something started. And especially if it's a wastewater treatment facility out there, then what we'll do is go back to the SRF and any other funds that may still be available. And ARPA may be available, who knows by then. So then we'd go back to SRF through the normal routes, which is about $1 million per fund. So we could probably get a couple million. And if that's just connecting, let's say I don't know, 15 blocks a year, we're on the right track. It may take us a while to get there, but we're on the right track. At least we've got a facility in place. We've got the largest majority of homes that are causing the biggest, what's the word I'm looking for? Focus on where the nitrates are. If we get Star City Gold Country, that's a huge impact. And then we start grabbing them a year at a time, trying to get, 6 to 8, 15 blocks at a time, that type of thing.
How does that work when, if you're going to put a facility in, you want to put a facility in that's going to lead you the ability in the future to hook up more?
Right.
So don't you have to go worst case scenario, or not just put a Band-Aid on this, but we're going to have to look at a facility that'll handle most of Grass Valley?
David, I'm assuming you're looking at the entirety of it, but in terms of the facility and whether it's scalable?
Correct. That's one of the things that the state requires, is that we only include reasonable growth, is what they call it. So there's only a certain amount of additional capacity that could be installed, say at this time, if grant funding or funding was available for a facility. What we'll look at is ways in which that facility over time could be expanded to increase by, say, a fourth, a third, a half, to accommodate additional growth. So we'll incorporate flexibility in there, but as far as the state is concerned at this point, they just only want to have you accommodate reasonable growth, is what they call it.
I see. That's a lot of money.
Yeah, this is Commissioner Hill. So how did you come up with the black lined area? By sample testing? It just seems from a construction standpoint that it would be more feasible to group your area together closer and start there versus the big drawn out area there.
Well, really the area of focus is by the elementary school and Gold Country and Star City. So just that northern portion of the black area. The other area to the south and west, encompassing the airport, is just a result of having to have a sewer main that conveys the sewage or wastewater from those tight residential areas over to the west to a wastewater treatment facility. The wastewater treatment facility could be located anywhere. However, we're suggesting that it be put out there further west, away by the airport, just to decrease the smell issues that may occur, and so on and so forth. Also, that parcel there is a City of Winnemucca parcel, and it would be easier to obtain permission to either purchase a portion of it or get an easement across it from the city versus some of these other private parcels that are closer by.
Okay, thank you.
We don't need to take any action. This is an informational only one.
Correct. Right.
Any other questions?
No, I'm glad to see we are heading in that direction. We've been talking about it in this community for at least 25 years.
Yeah.
I guess one question that comes to my mind, and I guess elephant in the room, or call it whatever you want, but Commissioner Hill, we know about this problem. Why do we keep permitting septic tanks out there? We just did 30 homes in the highest concentrated area. I think we have a moral obligation or whatever obligation to do something about that and quit making it worse than it is.
Dave Mendiola for the record. Yeah, and that's a great point. And we've talked about actually Churchill County. We've looked at an ordinance that they put together Similar situation. They needed to get rid of the septics and move on, and they did put it. It was very strongly worded, and that's something we certainly can look at. The biggest issue at this point in time is that if we do something like that now, is that you pretty much take any growth or all those private citizens wanting to do something out there off the table. And, you know, that could hurt people pretty badly. At this point in time, I think one thing when we do have our community meetings, that we need to make clear to them that if they're going to build out there, if they're doing something right now, that, you know, this is going to come one way or the other, because we can't continue to do the septic route. And so if they're going to build, they're going to have to put a septic in, and today that's allowed, but at some point in time, that's going to have to be replaced, and they're going to have to connect to the line. So
Won't it come to a point where the nitrates are so high where the state would step in and say, no more drinking this water or no more?
yeah, and that's why the ordinance, I think, has so much power behind it, because was my question. At what point in time does the EPA come in and say, stop? And you have to do other things, which, again, we're trying to get this not kicked down the road, but actually started down the road and get this done. So within the next couple of years, maybe even we can have something in place. That would be huge, especially if you capture Star City and Gold Country and that elementary school, which is a large producer of wastewater. If you do that, and I think it's also got the LDS churches in there too, if I'm not mistaken.
It is, yeah.
So those are pretty big producers, large crowds go there. And so that's a big piece of the pie that you would be able to capture. And then we begin immediately start working on where are we going to get the funding to start hooking everybody else up.
Okay. The area we're looking at is probably not even a quarter of the households out there. But it's less than that.
Yeah, I'm thinking, do we know that, David? I think it's 30 or 40%, I'm thinking.
Actually, I think it, just because those other lots, south and east are so large, I think that, I don't have the number right off the top of my head, but I do believe we're gathering the majority in that area.
Yeah.
Maybe half.
Think so?
Yeah.
That's where the concentration of the houses are, I guess, huh?
You see a lot of
Yeah,
these, a lot of these are
Excuse me.
empty,
Yeah.
5-10 acres with one household on them.
Yeah. Yeah, they're not the big problem. The big problem, I think, is what we tried to capture right here. That's where the highest concentrations are coming from.
Dave, this is Commissioner Haas. Once the wastewater plant is put in, what happens with the area in the septics? We won't be using a lot of them again. Do they come out of the ground, or I'm just looking at an overall cost, you know, per household to do what we're doing, hooking it up, and do we have to get rid of the septic tanks altogether?
You know, David, do you have an answer?
No.
Go ahead, I'm sorry.
We would disconnect, we would connect them to a lateral that's connected to a main. And so those would be left in place, but concreted or filled in so that they couldn't be utilized, plugged, in other words.
Okay. And that'll be up to the resident to do that?
Actually, that would probably be part of what somehow we've got to determine how we're going to go forward with this, but typically it's part of the project to install mains and connect the units, property units to the sewer collection system.
Thank you.
Yeah, Commissioner Haas. So that's kind of what I have been working with the state revolving fund, is saying if we got to do this, we have a wink link if we don't, if we're not able to cover all of the costs for those transitioning from septic to the main line. And they have agreed that they're going to support that. So that's the goal.
I was just concerned on whether they're leaving the septic in the ground whether the residential, people have to take them out of the ground, whether they have to fill them with sand, whether they got to fill them with concrete or, just the cost involved in selling this thing to the residents. And especially with the amount of building we're doing right this moment, these guys got a well and a septic and it costs them a lot of money. So, you're going to be sitting there and they're going to come to Dave and say, yeah.
Yeah, well,
What are you talking about?
Yeah, and I think that's like kind of the whole issue. I haven't even really focused on that right now. I'm just trying to get this through a process so we can move, find funding, and then we'll have plenty of time to go out and come up with solutions. I know, like I said, the funding that we're looking for is all part of it. So the goal is to have no expense for the individual homeowner to do this. The other question though is, you're right, what they do with them, it may come, from the EPA or some kind of ordinance that we have to put in place that tells them what they have to do. Because there needs to be something behind it, I think, to make sure they don't reconnect.
Yeah.
Okay. Anything further? Well, thank you. A lot of for that work, for your work, and continue to look forward to hearing from you more.
Thank you. Appreciate your time.
Thanks, David.
All right, that takes us item 11, which is cloud seeding grant with Humboldt County River Basin Authority. Consideration, discussion, possible approval of a grant in the amount of $3,500 as part of a cloud seeding project sponsored by the Humboldt River Basin Water Authority in partnership with members of the HRBWA, local mining interest, and other non-governmental agencies in Northern Nevada. Discussion and possible action. I was approached by this, and I think you approached Dave too. Jeff Fontaine called me. We have a couple of cloud seeding devices in the Santa Rosas that they put in, and I think it was 19, and they did use them that year. But we have Jeff on the line. And then 2020, they didn't get the funding to do it again, so they have just been sitting there. We have been and still are in a severe drought that doesn't look like it's going to be letting up anytime soon. We've been declared a disaster area, I know, at least 3 of the last 4 years in Humboldt County. And our water resources, our wells, our streams are in a pretty dire situation right now. I mean, just get out on the ground and take a look, and then we've got a lot of streams coming down. In 2019, when they did put this in, now I'm not going to say this is why we weren't declared a drought in 2019. I won't say that was all because of these devices, but I am close to where some of these devices are, and I would, I'll step out there and say I did think it made a difference when those storms went through and the use of these things. My idea is that, and talking to Jeff, and I'll let Jeff talk here in a minute, is there is other sources of money out there, like our soil conservation districts. I wouldn't know why they wouldn't want to. It would benefit you whether you're on a well or on ground or surface water, using surface water. And if every little drop that we can squeeze out of one of these storms right now is going to help. So, Jeff, I see you on the line there. You want to fill in the spaces here?
Thank you, Commissioner Cherry, and good afternoon to the commissioners. I know it's been a long day for you, so I'll try to be as brief as possible, but thank you for the opportunity to talk about this a little bit more. As Commissioner Cherry mentioned, our last Humboldt River Basin Water Authority meeting, we discussed at that time what was a possibility of getting a 50% cost share for cloud seeding in the Humboldt region. And that cost share would be provided by the Pennington Foundation. And they were willing to provide, and still are, up to 50% of the cost of cloud seeding operations in both the Ruby Mountain area and the Santa Rosa area as well. The last time that, well, let me back up and say that DRI has been doing cloud seeding in the Humboldt region for a long, long time. But in about early 2000, funding kind of dried up, so to speak, and the legislature wasn't providing money. And so it was kind of year to year with DRI and cloud seeding. The last time DRI did any cloud seeding in the Humboldt Basin was 2019. And before that, it was in 2012. So we were approached some time ago by DRI about this opportunity with the Pennington Foundation. What they told me was that for a total of $120,000, they could operate all 5 of their units that are currently in the Ruby Mountains and the 2 units in the Santa Rosa Mountains. So this includes the operation of the generators, their communications, their weather stations, maintenance, reporting, and post-season analysis. And so at $120,000, the Pennington Foundation is willing to provide $60,000 of that money. We have been out trying to secure matching funds. The $60,000 necessary to maximize the match. We're hoping to do so by the time the Humboldt River Basin Water Authority next meets in Winnemucca on September 10th. And as Commissioner Cherry mentioned, I've reached out to all of the Humboldt River Basin Water Authority member counties, and I'm aware that Elko and Pershing have already agendized, just like you have today, this item on their agendas. I'm waiting to hear back confirmation from Lander and Eureka. I've also reached out to Nevada Mining Association. They were very supportive. I've reached out to about 3 or 4 different individual mines, including Nevada Gold Mines, and they were present at our HRBWA meeting. I reached out to Nevada Cattlemen's, to Ruby Mountain Heli Ski Area, Farm Bureau, and recently reached out to Conservation District's Jake Tibbetts, who's on our board, was able to do a presentation at their meeting last week. So, you know, people often ask me, well, is cloud seeding effective? Does it work? And the answer is it works. It just depends on the conditions under which you're operating cloud seeding. And I can tell you that DRI has done a really good job at cloud seeding. They have analyzed all the locations in the Humboldt River Basin. They operate those cloud seeding units under ideal conditions or when conditions warrant. I personally visited the cloud seeding sort of center, if you will. It's at the Stead Airport that DRI operates out of. So the answer is yes, it does work under certain conditions. And in your packets, and specifically for sort of the estimates of how it went in 2019 when the cloud seeding was last done in the Humboldt Basin, there is in your packets, I believe, a report done specifically for the Santa Rosas. And just quickly, the analysis was that based on realistic values of 2 inches of snow water equivalent produced by cloud seeding, that produced more than 8,533 acre feet of water in the Santa Rosas. That's pretty significant, especially when you're talking about a cost of about $7 to $10 per acre foot of water produced. So I think that's really it. The last comment I want to make, and I know this came up in your previous meetings, so far, you know, the Pennington Foundation hasn't indicated that they're necessarily going to continue this in future years, but there's no doubt that if this is something that we're going to be doing, now's the time, and especially this year with the drought that we're in. And also, I would say that in my discussions with everybody that I've reached out to, this has come up as a question. I know in the past, HRBWA has tried to organize sort of a group to fund cloud seeding, and I believe Humboldt County may have even participated in some of that. But there's consensus that we need going forward to make sure that we don't have to go through this every single year to try to raise money or go to the legislature, but we have some mechanism by which, automatically every year DRI knows that they've got the budget to operate the maximum amount of cloud seeding units that they have available to them. And so that's a discussion for another day, but at least for the purposes of the upcoming winter season, what we're trying to do is raise the maximum amount of funding available from a variety of partners to match that $60,000 match opportunity from the Pennington Foundation. So thanks again, and I'm happy to answer any questions.
Any questions for Jeff? What do the commissioners think about this?
I think we should try. I mean, it's getting bad. And our springs are drying up, your wells are starting to drop, and it's not just here, it's all over. So if we don't give it a shot.
Yeah, there's no guarantees here. It's kind of depends. You got to have the moisture in the sky to bring it down, and if it doesn't show up. But if you're not prepared for it, and, even if we don't need a normal year. We need a above normal year, big time, just to catch up anymore. So anything we can add to these storms to increase the water table, not only for irrigators, for ranchers and farmers, but domestic wells and everything are dropping. And I think that anything that's pretty cheap. That's pretty cheap for the amount of water we potentially could get from this cloud seeding project.
Are those locations, cloud seeding locations, are they all in operable condition now?
Well, they pulled the machines down because they didn't do it last year and stored them there. They're still in Orvada, but they're, at least one of them is. I haven't seen either one of them lately, so maybe they came and got them. But they were here early in the summer, but I haven't seen them lately. But they can bring them back. They're on wheels. So I personally think it's worth a shot. And we've got, like Jeff said, I think the mines will kick in a good share. I think that we'll even maybe approach lithium if we, they're one of the neighbors now, and we'll be using some of the water. So there's another opportunity, I think. And so my personal opinion is I think it's $3,500 is nothing compared to what it could bring down for us. The help it could give us. And it may not, but got to try.
This is Commissioner Hill. So what little I know about cloud seeding, I did read on some over the weekend. It seems like it's pretty safe, the silver iodide or whatever, that environmentally safe and friendly to animals and everything else.
And their DRI has it's all set up. They know when the storms are coming through. They got computers that tell them there's a storm in the area. It's a certain temperature. It's got moisture in it. They release the iodide from Reno someplace.
Right.
They don't even have to come out here.
Yeah. I would agree too. I think anything to help get some more snowpack and put some more snow up there if we can do it in a safe manner. We need something.
Okay. Need a motion then.
Mr. Chair, I make a motion that Humboldt County approve a grant in the amount of $3,500 as part of a cloud seeding project sponsored by the Humboldt River Basin Water Authority in partnership with members of the HRBWA, local mining interest, and other non-governmental agencies in northern Nevada.
Okay. Motion is on the floor. Any further discussion? All in favor, say aye.
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 Okay, Jeff, we approved it. It passed unanimously. I would, do you know Melanie Atkins? She's kind of works with the soil conservation districts here in Humboldt County. If you got a hold of her, and explained what you're trying to do here, and that the county put in 3,500, and maybe she can approach the other soil conservation districts here.
Mr. Chair, I had a conversation with Melanie last week, and she was very helpful. And last week, the Conservation District State Conservation Commission held their quarterly meeting. Jake Tibbetts did a presentation for the group about that. I couldn't attend that meeting, but Melanie was very, very supportive. I will follow up with her to let her know the action that you took today, and appreciate that very much. And one other comment, if I may. We're not exactly sure the mechanism for transferring the money to DRI, but my sense is that probably the best approach is that DRI will want to enter into individual agreements or MOUs or whatever it is with every individual entity that contributes, as opposed to having it funnel through HRBWA. But we can work out the mechanics of that if that's okay with all of you.
Yeah, that sounds all right, I think. That'll be fine. Okay, well, hopefully you can get some of the other counties and other non-governmental groups to help join in.
Thank you very much.
Thank you.
Jeff. Mr. Chair.
Yes.
See that Mr. Shepherd has shown up. Can we move up to number 20, Hubbard House?
Are we okay with our 10 a.m. set to here?
Yeah, didn't need to be a 10 a.m. set to it. We'll just get that at the end.
I'm sorry, say it again, what number?
Number 20, Hubbard House.
Okay. We are going to move up to the Hubbard House demolition and asbestos removal. Consideration, discuss, and possible approval to demolish the Hubbard House located at 534 Bridge Street, Winnemucca, Nevada. The Hubbard House structure was inspected in 2020. The structure engineer determined that the building was not salvageable and should be demolished. Due to the age of the structure, it is anticipated that asbestos abatement will be necessary before demolition can be completed. The cost of the abatement, the asbestos, is not to exceed $13,124, and the cost to demolish the building is not to exceed $21,757. This is for discussion, possible action. Come on up, Mike.
Thank you, Mr. Chair. I'll start as Mike comes up here. So we've kind of been dealing with the Hubbard House since 2015, as I remember. And several groups have been through there trying to see if they could maybe renovate, do some different things. And we finally did a structural engineering report last year. The museum was a big part of that, and they funded that effort. And again, it was pretty much what we thought, that it was just not salvageable without massive costs. And so we're about ready to move forward. We've got several buildings in the county that need to be demolished, but I wanted to focus just on this one, and then we'll come back with the others later. So with that, Mike, I'll turn it over to you.
For the record, Mike Shepherd. As Dave mentioned, we actually were set up to demolish this prior to the group of young ladies that were, wanting to salvage it as a historical home. And we had put it out to bid, received 3 bids, and the folks from Impact Demolition were always very competitive. It's what they do. I think they had, they were a little less than this. Cost have changed a bit. We had another bid for about 50,000 and one for about 100. So with their competitive bids and the cost of the abatement and those kind of things, it looks like it's time for this little spot to be cleaned up on that property there. And your packet is pretty complete. And if you've looked it over and have any questions, I could probably address them.
We're looking at 35,000. That's about what we're looking at.
Correct. Yes.
Commissioner Haas, would there be any, we're looking at doing some more of the asbestos removal that probably should have been done a long time ago, but with bringing them in, would it be beneficial for us to do that at this time to get a better price out of everything?
Mike Shepard for the record. Commissioner Haas, we actually have individual not to exceed quotes from Advanced Installations. It was all orchestrated by Mr. Sato when he came in because the nature of the ones at the base were such that you really couldn't define it to create a bid document. It was, if you bid it, you'd have so many change orders. So we actually have those numbers. So I don't know if we would benefit. I would think they would be more efficient that way. And, if you did that, you'd probably have to do it on your next meeting, I guess. But I think it'd be worth asking the question of Advance. If they're here doing all three, there's got to be an efficiency. They're not mobilizing again, and got to be a few bucks to be saved.
I know I'm going to make a call to them, so see what they'll say about doing some more work down here. But
I think that's smart.
Yeah, we've already collected some. I don't think we've gotten all of the bids in yet. So, but we're trying to get that together. So we talked about doing them all at the same time. If we can, we will.
This is Commissioner Hill. Like Mr. Shepard had explained, I'm involved in this group too. The Quonset huts up there by the old Air Force Base is going to be a little different animal because of a lot more involved there, I guess. I guess my personal thoughts is that could cause quite a delay in this whole process if we were to go to that route. Not that I'm against it. I'd like to save a few bucks, but I think that cost is going to be surprisingly high by the time it's done. Correct me if I'm wrong, but I think those buildings up there are going to be a little different animal. Not that it doesn't need to be done, because I think it does, but.
So Commissioner, what we've got is when Andrew Sato brought them out here, Tom Davis, who's run that operation for as long as I can remember, and looked all these over, they provided not to exceed numbers on each of these. On the 3220 Bengachia is 14,590, and on they both are 3220. The lower building has less problem and less asbestos than the other. The lower building was $9,080. And the upper building was 14,590, which was a pleasant surprise to me because when they went in to do their investigation and they just found just so much asbestos, mostly in the panels and everything that they used. And he determined that there was piping and all sorts of things. And his idea was to quantify this to get a bid document. He said, I'll never get it quantified right. If I put a bid document together, you'll be full of change orders. And so I really thought we'd be facing, 20,000 or more. I mean, on the Veterans Building, we ended up spending nearly $50,000 because we got into a hantavirus thing. But I mean, just the initial asbestos on the Veterans Building that we did a couple of years ago, my recollection was in this range or a little bit higher. So I was pretty pleased with the
numbers.
These numbers that Advance put out to us.
So probably maybe worth doing it all at once.
I did notice there was quite a difference in the bids. One was quite a bit cheaper.
Yeah.
What are we gonna? Where's the money coming from, Dave?
So out of other general government, I've got a miscellaneous account in there that we can take it out of there. That's kind of where we've taken all of the upgrades to the vets complex.
This Commissioner Hill, do we have any plans to cover that lot with anything, or just tear it down and it becomes a?
We haven't really talked about that, but are you talking about Hubbard?
Yeah, Hubbard.
Yeah, Hubbard. Yeah, so we're thinking it would be nice to put some grass out there. I don't want a big dust bowl.
Right.
And, get some water on it, make it a little like park type thing for the time being. Put a couple of chairs or little picnic area, that thing.
Something to cover the
Or a
ground.
dog park. That was another thing that was brought up, do a little dog park there. So.
Jesse, as I remember the specification we originally put forth, we wanted it taken down to sidewalk, take those retaining walls out of there, and take it down and at least put a light bed of base on it. You know, and like Dave said, it would be a good idea to go ahead and grass it or something, but when they complete their work, we should have a respectable looking site, not just a roughed up remainder.
Okay. Well, my thoughts are it's a liability at this point. I think we need to get rid of it.
Yeah, we've looked at this building about saving it.
Mhm.
Just, it's not going to happen.
No, it's time.
Okay, Glenn, motion. Go ahead.
I'm going to make it, all right. This Commissioner Hill, I would make a motion that we approve the demolition of the Hubbard House located at 534 Bridge Street. It was inspected in 2020. The structural engineer determined that the building was not salvageable and should be demolished due to the age of the structure. It is anticipated that the asbestos abatement will be necessary. I guess it's already been done.
I would just make those not to exceed.
Yeah, the not to exceed of 13,124, and the cost of the demolition not to exceed 21,757, sorry.
Okay. Motion's on the floor. Is there any further discussion?
This is Commissioner House. Mike, does that include landfill costs in this? I mean, the whole package, or?
The way we put it to bid, Tom, was that we saw no reason to be paying landfill fees to the county. So I believe those were covered by the county. Now, of course, there's an arrangement that relates to the long component of it, but we thought to keep that out of it rather than add it in.
Okay.
So I suspect what you have is there's no county charges, but there's something between the county and DeLong that operates, I suspect.
What we'll have to do, Commissioner Haas, that's a great question because it reminded me, we'll need to come back before the landfill committee at the next meeting and get approval for that. So we talked about it at a landfill meeting a couple of years ago when we started the process, but I don't think we actually approved it. I could be wrong. We'll double check that.
Commissioner Hill, are the landfill costs higher for asbestos because does that have to be treated different, or is it all the same? It just gets buried?
Construction waste.
Construction waste.
One other thing worthy of note, Tom, is that these folks at Impact, I've worked with them, and all of the construction waste will have to go to landfill. But anything that are just earth, concrete type things, I allow them to take out to the pit on Cathy that Humboldt Ready Mix owns. Anytime we got clean, dirt and concrete stuff, we allow them to do that. So that amount, we don't want to pay $6 a yard to go up to the landfill with that.
Well, there will be a cost for the asbestos.
Yeah.
Going up here. It's written into contract.
Yeah.
So.
Well, the other advantage to that, Mike, is, and appreciate you doing that, is it doesn't fill up our landfill with concrete when we could be using it to dispose of garbage and waste and food, and it's nice.
Yeah.
Thank you.
Okay. Any other questions? If not, all in favor, say aye.
Aye.
Okay, passes unanimously. Thank you, Mike.
Thank you, gentlemen. We'll get the commercial arrangements moving with these two companies.
Okay.
Thanks,
Thank
Mike.
you. Thank you. How's that lunch coming?
Yeah.
It's here.
1 o'clock, should we eat?
Sorry. No lunch.
We got, Don is up next, but maybe while you eat, we could do Don or Rick, since Rick's here.
Rick's here.
Give us a few minutes to get lunch.
Want to do it while we're eating?
It's up to you.
I'm good with it. You don't mind seeing us eat while you're talking? Okay. We'll just,
If you complain, you can go away for a while.
Just don't talk with your mouth full.
Picky, picky, picky.
Won't be the first time.
She said, no, we'll have to bring our own next time.
We have this policy.
Did I do somebody else's? Oh, no. Oh, I did. No, I didn't.
I'll just go.
That's Diet Coke, right?
Do they? I'll bet they do. I should have went with the other.
It was interesting. I'll keep there.
Sure.
You know, it's really interesting. Events center. Kind of, you're not supposed to say that, could it?
Oh, really?
Yeah.
That's,
They got a lot of money in Fallon.
That'll be interesting. See what happens.
Heard you got to meet all the animals.
Yeah.
Did you get to see the bulldog?
Yeah. No, I didn't meet the bulldog. He kept hiding the bulldog, but
Oh,
I got to meet all the chickens.
oh, good. Bulldog's my favorite.
Yeah, that's what he said.
He's
one here. So let me read. This is 2021, Dave.
Yes.
Technology Services request approval for equipment purchase, approval for Harney Electric to make modifications to power to McDermott Public Safety Communications site, waiver of attrition policy, consideration, discussion, possible approval. So we'll begin with A, which is to purchase computer equipment to replace the equipment that have expired warranties, are out of date, or out of service in the amount not to exceed $73,882.51.
Good afternoon, Rick Grantham, Technology Services. Yeah, we provided this list of all the items that we're ordering on this whole list. But there's only several things that are on there that are over $5,000, but we wanted to be transparent and show you all the items that we were going to be putting in for order. Just one little caveat to all this is Dell is also telling us that we may not get parts until well into next year. So these orders will be placed, hopefully get in the queue. As they build them, we can get them. But we're already seeing delays on just laptops and computer equipment.
Mr. Chair.
Are they going to be out of date by the time we get them?
Yeah.
No.
No.
Technology's changing fast, but not that fast.
Okay.
Can I just add one thing in here? So I really wanted Rick to show this list here. And I think the important part is column 1, which shows you